is going to get special lighting up here as well. All right. Are we going live, guys? All right. Wow, you guys all got quiet. So nice. Thank you so much for being here this morning. Welcome to the San Francisco AI Forum. My name is Jane Gong, and I'm the Director of Emerging Technologies for the City and County of San Francisco. And to those of you who are watching us on the live stream, thank you so much for spending your morning with us. I promise it's going to be a treat. Before I get started, let's go over a few housekeeping items. Wi-Fi is available at #SFLibraryWiFi. Absolutely no food or drinks are allowed, except for our speakers. Otherwise, they won't invite us back. We will take a short break between the panel and the fireside chat, where you can stretch your legs. There's water and coffee in the Latino room, and restrooms are right outside. And remember, emergency exits are to the back of the auditorium and on the sides. And for today's agenda and our speaker bios, go ahead and scan that QR code behind me. And for those of you that are watching online, go to sf.gov/SF-AI-forum. And now I have the honor of welcoming to the stage our City Administrator, Carmen Chu, who will help us officially kick off the SF AI Forum. Welcome, Carmen.
Good morning, everybody, and welcome to AI Week. I want to take a very brief moment to thank Jane Gong and, of course, Mike Maxman for helping to organize this great event. But of course, this kind of event wouldn't be possible without great partnership with our San Francisco Public Library, of course, Michael Lambert, who you'll hear from in a bit. We have a really, really exciting panel and fireside chat for all of you, and so I want to, of course, welcome and thank you all for being here. I think for many of us, AI, especially generative AI, is something that is very much on our minds. We think about it, we know we're interacting with it in our day-to-day lives externally, and we know that it is something that is going to change and move fundamentally how we do our work, how we engage. But I think for many of us, we probably feel some hesitation, some worries, have a lot of questions about how we actually do this in the space of government. And so I think some of the experts that you're going to hear from today will help you think through some of those things, but also give you some food for thought. And I think this is really a journey. It's going to be a journey for all of us, whether you are a department head who is in the room here thinking about how to lead your organization, a supervisor or manager who is seeking to figure out how to help your team do its job and relieve some of the grunt work and pain points that you have within your operations, or you are someone who are a staff member who is like, you know, I've actually tested some of the co-pilot work, and I think that there's more that I can do here. There's a lot for us to be curious about, to ask about, and to just really explore. And I think it's incumbent on all of us here, whether, again, you're the manager, the director, or the line staff, to make sure that you are being responsible in how it is that we're using this. I think the public demands that of us. They expect us to deliver not only important public service, but they also expect us to do this with transparency and also with integrity and with ethics. And so it's something that is really part of our underpinning here as public servants. And so I'm so excited to be here with you today. I do want to acknowledge our sheriff, Sheriff Paul Miyamoto, who has joined us. He's always thinking about ways to innovate in all of the spaces, and I think this is a part of San Francisco's DNA. We're always a city of innovation, thinking about the next thing, whether it's inventing the next culinary delight or it's thinking about AI and technology. We really are transforming and changing the world and how we lead. So I want to thank you all again for being part of that. As city employees, I also want to give you a big thanks in this holiday season for all the work that you do to serve our city. The work is not easy and often isn't recognized, and I just want to say thank you to all of you for all the contributions that you make day in and day out to our great city. With that, I do want to let you know that we're going to have many, many speakers today, and you're going to hear from them in a bit, but I do want to make sure to introduce, of course, our next speaker, who is the city librarian, to just kick us off. And I said just a little bit, come on up, Michael, but Michael and his team has been doing an amazing job across all of our branch libraries and here at the main public library to make sure that they're expanding education and opportunity for people across our city, and what better way than all of our branch libraries. So without further ado, Michael Lambert.
Thank you so much, Carmen. Thank you so much, Carmen, and welcome everyone. It is so wonderful to be here and connect with all of you and see this room full. You all are helping our performance measures this morning, so thank you so much. You know, in my role as city librarian, I often engage with library leaders all over the country and sometimes around the globe. And I can say with confidence that in San Francisco, we have the greatest public library in the country. It's true. We have one of the most innovative urban libraries as well, and it's only fitting for one of the greatest cities in the world and the tech capital of the Bay Area in Silicon Valley. In the past few weeks, I had the opportunity to keynote a library conference in Taiwan and visit several new libraries there. I saw the future of libraries in some of the most newly constructed libraries in Asia. Libraries that employed robots and artificial intelligence to automate some of the core functions of libraries: reader's advisory, information assistance, and maintenance of collections. So you may wonder why the Ministry of Education in Taiwan invited me to speak about the San Francisco Public Library if their libraries are more technologically advanced than we are. And the answer lies in how our libraries operate as social infrastructure, anchoring our neighborhoods to foster community and civic engagement, and how we amplify culture and celebrate the rich diversity of our city through programming and partnerships. Yes. You know, even in this age of AI, the truth is our library workers are our greatest asset. Our staff is the greatest strength of our library system in delivering such a broad range of programs and services to enrich people's lives. No surprise, I'm actually very optimistic about the future of libraries. Libraries are more important now than ever. So I believe AI will not replace library workers, but I'm also bullish about the power of artificial intelligence and automation to enhance the level of service our staff is able to deliver. I envision a day in which the library workers who employ AI will deliver more value in helping our residents attain their goals, be more successful, and achieve the brighter future they're seeking for themselves and their loved ones. This is the promise of AI. And that's why I'm so excited that our department is partnering with the Office of the City Administrator and the Department of Technology to host this AI Week to stimulate a dialogue and raise our collective awareness. One other plug about AI Week: the library's signature event, One City, One Book, will happen later this evening in this very same auditorium. And if you're not familiar with it, One City, One Book is meant to encourage all San Franciscans to read the same book at the same time in order to provide common ground for conversation and connection. This year's selection is The Worlds I See: Curiosity, Exploration, and Discovery at the Dawn of AI by Dr. Fei-Fei Li. So this book is a must-read for its intimate depiction of the birth of modern AI and deep learning. Dr. Li's memoir is also a poignant immigrant story, very timely in this moment. So if you haven't read it yet, please go upstairs and pick up a copy on your way out, or you can check out the ebook online. All right, now it's my pleasure to welcome my dear friend and colleague, Michael Maxman, CIO for the City and County of San Francisco. Let's give it up.
Thank you, Michael, so much. And it is an amazing book. I hope everybody reads it. Thank you, Carmen and Michael. And thank you again to the Public Library for hosting us here. Isn't it fitting that we gather here to learn about AI in a place dedicated to knowledge? Today, what we're doing is we're building the next chapter of public infrastructure, of public knowledge. And I'm really excited to be here. Well, I have an honor to introduce somebody special to all of you. And the work around AI requires really bold leadership, thoughtful, committed to delivering real improvements for San Franciscans. And we're fortunate in San Francisco to have the mayor who not only understands the promise of technology, but actually champions making it real for everyone. Under Mayor Lurie's leadership, we've launched Copilot Chat to all city employees to make sure that everybody has secure, reliable tool in their hands. It's one of the largest AI deployment in the whole country. The mayor also championed expanding digital equity to all affordable and public housing. And right now, we provide internet access, high-speed, reliable, to over 23,000 families in San Francisco to make sure that no one is left behind in this new age of AI. We're deploying Wi-Fi to Chinatown and many other places, making sure that all of our neighborhoods benefit from this new digital age. The Mayor Lurie encouraged us to experiment with AI, but experiment safely, ensuring that transparency, collaboration is with investments we make. From the new AI leadership program for city leaders, to the incubator partnership, to this wonderful forum. And most importantly, the mayor reminds us that our work is not about technology for its own sake. It's really about better service, stronger trust, and more responsive government for every resident of San Francisco. It is my honor to introduce somebody who believes in this mission, who invests in it and pushes us to deliver more every day. Please join me in welcoming Mayor Lurie, Mayor of San Francisco.
Thank you, Michael. I appreciate the intro. I also want to acknowledge Carmen. We just reappointed Carmen yesterday to a second term as city administrator. And I look forward to working with you, Carmen. I know everybody in this room does too, so thank you for your leadership. Good morning to all of you. You know, we always say this in San Francisco. San Francisco is the place where the future is built. We always have been, we always will be. And I also always say that every other city, I talk to, you know, a number of mayors around the country, and actually have had the opportunity to speak to people around the world, and they're like, I wish I had just one of the companies that you have here in San Francisco, whether you're talking about Anthropic or Databricks or OpenAI or Cursor. I mean, the list it's actually really crazy, but they're all here. They're all in our city. We have the most innovative companies. We have a creative workforce. We have a long history of using technology to expand opportunity. And today, artificial intelligence transforms every industry around us. We also have a responsibility and a tremendous opportunity to make sure it strengthens the work that you all are doing every day to deliver services for the people of San Francisco. Let me be crystal clear. We are not adopting AI because it's a trend. We're adopting AI because it helps us solve real problems that affect real people. Earlier this year, as Michael mentioned, we put Copilot Chat in the hands of every city employee after a successful 6-month pilot. Many staff reported saving up to 5 hours a week on drafting reports or summarizing case files. And I know we have a long way to go on that front, but it's a good start. This means more time for our nurses, our caseworkers, inspectors, and frontline staff to focus on what matters most: serving the public. That means cleaner streets, better communication with residents, better results. I actually just stopped in the rain just across the plaza here and met up with the HOT team, 10, 12 HOT team members, figuring out data, they're using data, they're communicating with each other in real time. As far as AI goes, we're going to adopt it responsibly. San Francisco is one of the only cities in the country with an AI transparency ordinance, which requires the city to disclose when and how we use AI. Every department must identify where AI is in use, evaluate it for potential risks, and describe the safeguards in place to protect our residents. we are also building our own internal expertise. On December 2nd, we launched the SFAI Leadership Program, a first-of-its-kind training for city leadership across every department. We're also equipping managers, analysts, and frontline employees with skills to use AI tools. And I know I got feedback on those trainings from Carmen and others. Some went really well, and some need some work. And so let's make sure that we get the responses from all of you. Let's hear from all of you to make sure that we continue to get stronger on that. And we're going to put this knowledge to work through real pilots. Outreach teams lacked a shared needs and services history for people experiencing homelessness. With AI now, teams have that unified picture that I just described, so they can make faster, more informed decisions and care and coordinate more effectively across departments. The city partnered with Stanford to apply AI to nearly 16 million words of municipal code to identify outdated and duplicative requirements. We identified inefficiencies in fuel use and vehicle deployment across city fleet. AI now helps optimize routing, monitor usage patterns, and manage resources more efficiently. These projects also reflect a simple principle. AI should make government more human, not less. It should free people from busy work so they can do the work that requires judgment, empathy, and connection. I think that is critically important. Responsible innovation doesn't happen in a silo. It happens when public servants, when all of you, technologists, librarians, researchers, and residents sit at the same table, talk honestly about what's possible, and we build this together. And that's what today is about, and that's what we're going to be doing going forward. So today, you're going to hear from industry leaders from across government, industry, academia, and following me, Carmen will lead a panel that explores how San Francisco can harness AI to improve government services while ensuring it remains responsible. After that, you're going to hear from others, including David Chu. And this afternoon, I'm thrilled to announce the launch of our new incubator partnership with the SF City Science Lab in collaboration with the MIT Media Lab. And that is a big deal. This new Civic Innovation Hub will match real city challenges with technologists and developers who want to help solve them. This is a new model for civic innovation, one that turns good ideas into minimum viable pilots quickly, safely, and transparently. And later tonight, you already said this, Michael, you're going to have our great author, Dr. Fei Li, as part of our One City, One Book, and my wife is opening up that session. She's excited about that. She's read the book, Michael. I still need to. You all give me too much reading. San Francisco is leading, and we're going to do it with transparency and with the people of this city at the center of every decision that we make. Michael, I want to thank you. I want to thank you, Carmen. I want to thank Mike. Thank you for your leadership, and to our emerging technologies team. Under your leadership, San Francisco is moving forward with AI. And I see so many department heads in here and people that make this city run. I want to thank you all for being here, taking time out of your crazy, hectic schedules, but I think this is incredibly important, so I appreciate it. I'm proud about what we've started, and I'm proud to be alongside you as we implement this new technology. This is the next chapter for our city. So let's go, San Francisco. Have a good day.
Let's hear it once again for Mayor of San Francisco, Daniel Lurie. And thank you to all of our speakers this morning for grounding us in why this moment matters. Like the mayor said, AI not for its own sake, but in service of every single San Franciscan. And that's why we're all here. We now move into our panel, AI in Government, Promise and Risk. We've brought together a remarkable group representing healthcare, academia, and the public sector. These are leaders who understand what it takes to innovate responsibly while safeguarding equity and trust. Please welcome back to the stage our City Administrator Carmen Chu and our panelists, Dr. Daniel Yang, Professor Deirdre Mulligan, and Derek O. Yang. Thank you so much.
All right. Let's see. Does this work? Yes. All right. Well, thank you again. I know that the mayor has left, but again, I want to acknowledge his leadership and really helping to drive this. I've got, originally I was going to start off with an opening, but actually I don't think we need to because we have just such brilliant people before you that I want to make sure that we're spending as much time with them as possible. I'm going to just do a quick introduction so that you see the caliber and talent that is up here, and why we're so excited. We've got in the middle here Professor Deirdre Mulligan, UC Berkeley School of Information, and the former Principal Deputy U.S. Chief Technology Officer under the Biden-Harris administration. Her research explores legal and technical means of protecting values such as privacy, freedom of expression, and fairness. And her work is actually known for this focus on equity, democratic values, and technology. I want to thank her for being here. I think you also have a recent appointment by Governor Newsom, and that as a, what are you serving on?
Oh, on the new Innovation Council, particularly on, Yes, I should use a microphone. On the new Innovation Council that was just established and working through the council and with the new Emerging Tech Accelerator that was established to help the state of California use technology to do big things responsibly for the public. And I couldn't be happier to get this chance to really focus on implementation.
Thank you so much. Our other speaker is Dr. Daniel Yang, who sits right here. He's the VP of Artificial Intelligence and Emerging Technologies at Kaiser Permanente. He leads the organization's effort to advance safe and equitable mission-aligned AI. He's a practicing internal medicine physician, and he previously directed a major diagnostic excellence program at the Gordon Betty Moore Foundation and trained at UCSF, our hometown school, Stanford, and of course, University of Chicago, Illinois. One of the things that I see is really compelling about Daniel's work here and something that could be really helpful for us is that he's really had deep work in helping to build public-private partnerships to promote responsible use of AI, especially in the healthcare sector, whether it was creating the National Academy of Medicine AI Code of Conduct, Coalition for Health AI, or Health AI Partnership, something that he's thought deeply about in that practice. So thank you for being here. And of course, Derek O. Yang is a research director at Stanford Reg Lab, and executive director at City Systems. Just a quick note, this is a part of the Fireside chat that you're going to hear later on with City Attorney David Hsu. Reg Lab partners with government agencies and helps to design, evaluate programs and policies and technologies that modernize government. So really much in line with some of the things that we're thinking about here. He graduated from Stanford in 2013 with a dual bachelor's degree in civil and environmental engineering and architectural design, and in 2015, master's degree in structural engineering and geomechanics. And so we're gonna have to find out how all these things connect, but I'm sure they do to AI. With that, I'm gonna just start off with a simple question, which of course, anyone who knows and loves San Francisco, you gotta tell us, what's your favorite thing to eat when you come to visit San Francisco? Let's start off with that.
This was not on the prepared. I love dim sum. So I've been in SF for many, many years, and so loved Hong Kong Lounge too, and it's the best value you can get in the city.
Awesome, yes.
There are so many things that I love to eat in San Francisco, but Tartine is the place that I take every visitor to town.
I used to live for 6 years just a couple blocks away, so especially right here, Arsico, there's a branch nearby, and there's a nice vegan Thai restaurant just around the block as well.
Awesome. Well, I think as you heard the oohs and ahs from the crowd here, we're definitely a food-motivated crowd. And we will have food for thought as we head into this AI conversation. So I'm going to kick it off with Deirdre for our first question here. And I think maybe this is a good beginning point, which I think for many of us, as we talked about, we're thinking a lot about how AI and especially generative AI intersects with our work in providing government and public services. And I just wonder if you have some thoughts about how local governments should prepare or organize our approach towards AI. What would be some of the thoughts that you have, especially given some of your experience at the federal level?
Sure. I just want to start. This is a time when public servants are just under attack, and there's a lack of appreciation of the fact that you are the government, you are democracy, you're the infrastructure. And I just want to recognize all of you and thank you for your work and let you know that there are many people who are incredibly grateful for the career choices you've made, the expertise, as Mayor Lurie said, the empathy, the orientation towards service and care, and integrity that civil servants embody. And I second want to say, what a total pleasure to get to do this in a library. This sign over here about life, liberty, and libraries. If libraries designed all technology, think about what the infrastructure would look like, right? The ethos. Librarians have been on the front lines of all of our important policy efforts around privacy, around civil liberties more broadly. Think about the creation of an institution that was going to democratize, in a real way, access to information for the public. And so I just want to thank you all for doing this here. Having been in the Biden-Harris administration, I have some understanding of what it takes to actually think about integrating a powerful new technology across a wildly diverse and set of agencies. And agencies that are serving public missions, not market opportunities, have very specific challenges. They can't make something that works for some niche in the market. They have to make things that work and work well for everyone, and ideally don't require lots of out-of-band processing, because we know that out-of-band processing means people don't get their services, people don't have their needs met, and we have enormous staff costs. And so really doing that pilot testing and getting things right is so incredibly important when you're looking to do the work that all of you do with such care on a daily basis. So there are three things that people always talk about, right? The need to prioritize policy, procurement, and workforce readiness. And I have to tell you, do all three together. And why is that? Well, you need policy to set your goals and strategy, and I think Mayor Lurie gave you your North Star, which is about impact, right? It's about how do we meet people where they are and change people's lives for the better. It's not measured in some metric about how many AI deployments we have, or right? It's focusing on how this is going to meet people's needs. And you need policy and leadership from the top to really set that guiding star and say our goal is going to be how we're changing people's lives. Two, you need to ensure that your procurement processes are modernized so that you can, one, do those sorts of evaluations, get the data, the documentation, and most importantly, and often overlooked, the freedom to do the testing and evaluation, including that pilot testing, so that you don't have to rely on vendor promises and hand-waving, but you can actually do those evaluations yourselves or with folks at the Reg Lab or Berkeley or MIT. I think you should look closer to home. But we love all of our colleagues. And finally, one of the things that my team at OSTP had a key role in during the administration was the AI and AI-enabling tech talent surge and getting the right people in. And it's not just people with machine learning expertise or data science. It's also people who do user interface design. It is people who understand the privacy and equity issues and how we work with data, because your values have to inform product, not just policy. So you have to move big on all three of those. I know it's daunting, and I think I can say that there are many of us who are here and really happy to help. So thank you.
Thank you, Deirdre. And for the panelists, if there's additional comments or you've got a thought and you want to add to it, please feel free to jump in. I think just having a good conversation is what we're hoping to inspire. I'm going to jump to you, Derek, for a minute, because I think in government, and especially in San Francisco, we tend to sometimes reinvent the wheel and go it alone, right? And think that we have to start from scratch. But that's not the case. And I think Deirdre's alluding a little bit to this. In RegLab, there is a partnership that does exist to really help move these relationships forward and this progress forward. And so I wonder what you think about the relationship between academia, the public sector, and how we can connect this to the private AI industry.
Yeah, it's a great question. So the RegLab is based in the law school at Stanford, and we have partnerships with a lot of different government agencies, from the local to the state to the federal level, and that's our kind of bloodline. We just love working and supporting the public sector. And I think stepping back, we think that's a little bit undervalued in the relationship between really the three entities you described: academia, the public sector, and the private sector. Obviously, the big undercurrent that we're all experiencing right now is that the private sector is really pushing scale around AI technologies. And often the public sector is really just one of the potential use cases. We're talking about uses in business and uses in the public writ large. And I think at the onset, it's really important to distinguish that I think for most of our conversation here, we'll be talking about public sector uses. And those are not necessarily the same and maybe quite distinct from other uses that are really the forefront of media conversation on AI. So from a government's perspective, I think a key kind of challenge is you have this technology to procure, you have services to be thinking about and vetting that are potentially being sold to the public sector, and then you have this potential to have to consult out at times if that underlying tech talent just has this disproportionate imbalance between what public sector is able to pay for versus the private sector, and so we see these from RegLab as fundamental challenges. And we're really interested in a model of, can we provide demonstration projects in which an academic impact lab, as we are at Stanford, is really embedded deeply with a public sector partner and helping build that capacity internally and really think through substantive, concrete challenges, specific problems. And I think that really helps create more capacity empowerment for public sector entities to then look back to the private sector and say, maybe we can separate the wheat from the chaff a little bit more in terms of what folks are selling. There's a recent book as well called AI Snake Oil, which I think is a good one to read. And potentially build a lot of those capabilities in-house so you didn't have to contract out in the first place. So I think that's a model that has been gaining momentum, but it's still really undervalued, underappreciated. And like Deirdre mentioned, I think there are so many ways that the city and county of San Francisco can partner with the many different institutions locally to just continue to build that type of symbiosis between the academic and public sectors.
Question, anybody here interested in potentially partner with RegLab? Okay, Derek, we're going to have a sign-up sheet here that's ready for you to go. But I do think that this is part of the challenge. Sometimes we don't know what we don't know in terms of emerging technology. And I think we're really hungry to figure out how should we be thinking about and parsing out and evaluating things. And I think for an institution that is thinking day in and day out about that, I think that could really be a strong partnership as we are exploring different avenues for how we might embed it within our work.
Can I just say that the reverse is also entirely true, if not more true, that from the academic sector, we also don't know what we don't know. And that's true for the private sector. And I think a lot of the mismatch in sort of the attention has been under-recognizing all the different true public sector challenges there are and how they can be addressed through AI. So I think from our perspective, it's been kind of moving from academia writ large, this kind of ivory tower mindset, to really understanding that we have significant blind spots in understanding the use cases and the potential equity and so forth impacts of technology. And so that's part of why we're so fundamentally committed to coming as a partner alongside city agencies, embedding within them. And usually we're learning a lot to catch up to the table. And then there's really reciprocity in that relationship.
Fantastic. Well, I do want to turn our attention to Daniel, Dr. Yang, because I think this is actually a lot of the conversation that I've heard from folks around the city is, well, but give me a use case. Tell me how it actually got used. So how does this actually apply to something real that I can understand and see as tangible? So I wanted to ask you, Dr. Yang, you're both a practitioner, but you're also operating in a space where the consequences of getting things wrong are really high, especially in the healthcare sector. And I think many of us feel that way for many of the populations and communities that we serve. We don't want to get things wrong because that could have really significant and problematic consequences for the people that we serve. So I just wonder, what kind of lessons did you take in healthcare AI's journey to help our public institutions modernize our services response? So what kinds of things are applicable as you thought about the application to the healthcare setting to what we're doing? What kind of things were you thinking through, were you grappling with that we should be thinking through?
Yeah, great question. First, just let me introduce myself. I feel like I'm kind of here to bring an outside-in perspective. So as Carmen mentioned, I am a practicing physician, work part-time both in the emergency department of the San Francisco VA Medical Center and also work in urgent care at SFGovTV for Kaiser. So if any of you are members, I hope I don't see you there. And so that really grounds my perspective around AI and really driving support for our clinicians as well as for our members. But to give you the outside-in perspective, and just to give you a little bit of context around healthcare, because not all of you work and live and breathe in healthcare, if I were to distill the core issue that we're grappling with in healthcare, not just at KP, but across the industry, it's a growing mismatch between supply and demand, where demand for healthcare services continues to go up, driven in large part by demographic shifts, right? We have an aging population in the United States. And while it's terrific, Americans are living longer, they're also accumulating chronic diseases as they age, and so delivering high-quality care for them is much more complex. And the second demographic shift we're grappling with is also the rise of millennials, which are now the largest generation in the US, with changing consumer expectations of healthcare, right? And as a millennial myself, I can tell you that we want to consume healthcare like we want to consume TV shows on our computer. Like, we want things on demand. We're no longer willing to wait 4 weeks to see our primary care doctor. And so those changes are placing an incredible amount of stress on our care delivery system. Demand is through the roof. And so normally in most other sectors, demand goes up, you increase supply. We can't do that in healthcare because we deliver extraordinarily challenging services by very, very well-trained clinicians. And we have a growing shortage of those clinicians. And so what happens when demand outpaces supply? The core issues we're seeing in healthcare today are the consequences of that mismatch. We're seeing rising costs of care to unsustainable levels. We're seeing patients waiting longer to see their providers, so access delays. And we're seeing an increasingly burnt out clinical workforce because we're asking them to see more patients, more complex patients with the same number of hours each day. Right, so that's the landscape that we're grappling with. So first and foremost, how are we thinking about AI? Well, how do we address those issues with AI? So I'll give you one example. We're really proud that at Kaiser Permanente, we've deployed the largest implementation of a generative AI technology in a clinical setting in the United States, if not in the entire world. So we've made available what we call an ambient scribe technology, which helps draft a clinical note for our clinicians. We've deployed it to our over 25,000 doctors across the organization and increasingly many of our advanced practice providers. And the way the technology works, if any of you used Copilot for Teams, you probably know the most amazing thing is it can create a summary at the end of the visit. It's a very similar technology, but just applied to the clinical setting. So the workflow is, our provider will ask consent to use the AI tool from the patient to record the visit. Assuming consent is obtained, the doctor turns on the tool, does the visit as normally. At the end of the visit, swivels to the computer, a first draft of the note is written, they're able to review, edit, and sign into the medical record. And why we tackled that as really our first big enterprise program, our doctors spend 2 hours on the computer for every hour they spend seeing patients. And oftentimes those 2 hours that they spend is spent at home, what we call pajama time, which is what our doctors do after they see 20 patients during the day. They rush home, they have dinner with their kids, they put them to sleep, they put on their pajamas, they jump back on the computer, and then they finish their notes from the day. And they do that every single day. And you can imagine that's a driver of burnout. And so we really wanted to support our clinical workforce. We wanted to reduce some of the administrative burden. We wanted to take away some of the work that's critically important, but it's not why I went into medicine. It's not why people go into medicine to spend 2 hours in front of a computer documenting everything. And so, unsurprisingly, after we deployed this technology across our enterprise, I mean, the number of love letters that we've gotten from our clinicians has been very satisfying. I'll just give you one example. One of the clinicians said, "This may not make me a better doctor, but it makes me a better mom because I can go home on time. You know, like I can catch my kid's soccer game." And so that kind of profound impact on people's lives, it completely changed perspectives on AI from one of resistance and reluctance to one of, this is actually impacting my life. This is making the quality of my life better. But I would actually say it's more than just, it does make them better doctors. Our patients are telling that to us. Our patients are telling us that our doctors are paying more attention to them in the visit. Right? How many of you have taken a half day off work to go see your doctor and spend the majority of your 10-minute, 15-minute visit staring at your doctor's back as they're typing into the computer? And so with the introduction of AI, we actually liberate our providers from their keyboards. We allow them to refocus their attention from the computer screen back to the patient's faces. Exactly what the mayor said. It makes healthcare paradoxically more human again. And if any of you are KP members and have seen it, the computer is in the corner, right? And it's a conversation between two human beings. There's also other really interesting elements of, we're hearing there's greater transparency in the visit, because one of the corollary side effects, if you want the AI to document the physical exam, you have to say it out loud, right? It can't observe it unless it hears it. And so now you have physicians that are dictating physical exam findings out loud, which normally as a patient, you're like, doctor, listen to my heart, listen to my lung. They don't say anything. I'm hoping everything's okay. And now the doctor is dictating those findings. Your lungs sound clear, your heart sounds normal. I'm not experiencing or feeling any masses or a distension in your abdomen, et cetera. And so, you know, that's one example of how that use of AI has really driven employee adoption, trust, excitement. The second use case I'll give is not a Gen AI, it's machine learning. It was an algorithm developed by researchers in Oakland, and the purpose was to identify KP members who were hospitalized, but were likely to get much sicker in the next 12 hours. So it's predicting clinical decompensation. And by decompensation, I mean they might unexpectedly land in the ICU, or code blue would be called on them in the hospital, right? Very serious events, including death. And the goal is by identifying these patients 12 hours before that happens, we could then intervene earlier, thereby preventing those negative outcomes. So we eventually deployed that program, we call it the Advanced Alert Monitoring Program, across our 21 hospitals in Northern California. And then we rigorously evaluated the impact of that program. And what did we find? We found that this program actually had a mortality reduction in the hospital. It was saving lives. And the way we studied it is we kind of rolled out the program over time. And so we were able to match patients who were treated in hospitals with the same conditions that had the program installed versus those that didn't have the program installed. So we were able to control it that way. And when we estimated across the patients we treat in our Northern California hospitals, it saves 500 lives per year, this one program. And just to put that number into context, that's roughly equivalent to all deaths from car accidents in the 9 counties of the Bay Area, right? And so here we have an example. You're right, the risks are great in healthcare, but so are the benefits. And so here we have an example of AI, machine learning, really driving mortality benefit.
That's fantastic, and I think you heard from the crowd the reaction. I'm a mother of a 1-year-old and a 6-year-old, and I think the burnout and some of the things that we have to do after getting home is real. So I think in thinking about how it is that we support our employees, I think this is a pretty critical turning point. How is it that we make their lives better, fuller? But I did want to just get on that issue about risk for just a minute a little bit more, because you talked a lot about kind of the success and the outcomes, but what did you do beforehand? Because again, because of the consequences, you know, the scribe, but also the predictive kind of work, there are consequences to getting it wrong. So how did you kind of, what things did you do to think through those mitigations early on?
Yeah. I'd say 2 things. One is be very thoughtful on what problems you tackle. So I joined KP a little over 2 years ago. The deployment to the Ambient Scribe was the first big enterprise program that I helped to lead. And we treated it like we had a command center set up for our deployment of this AI technology. We had the senior most executives, EVPs. We met every Friday morning from 7 a.m. to 8 a.m. It's the only time that you could find these leaders that had time. And we met for months, right? We treated it like a COVID response. Every meeting was full of issues. And we had under us hundreds, sometimes even thousands. We had IT teams that would round in hospitals with our clinicians, providing on-the-elbow support, helping them log in, collecting feedback. We would take that feedback, we would analyze it, we would send it to the vendor. I mean, we put a lot of time and energy and resources in getting it right. That's how we were able to go from 0 to 25,000 providers in 6 months. And I say that because you can't do that level of rigor and thoughtful quality assurance testing and implementation support for 100 use cases. KP, we have 230,000 employees. We cannot manage 10 use cases with that level of rigor. So one, if you want to do it, if you want to deploy technology responsibly and at scale and get out of the pilot realm of 1,000 pilots that probably go nowhere, is focus, prioritize, choose a problem that really matters, put the time, energy, resources, and intention that it deserves, do it well. You will find success, you will find trust. It will allow you to do the next deployment a little bit easier. And you know, I have a 2-year-old at home, and so I was reminded watching my 2-year-old grow up, you know, you have to learn how to crawl before you walk, walk before you run. And there is desire, everyone wants to run out of the gate. And I think it's really important organizationally that we have to learn how to like crawl our way out. It is slow. Implementation, good implementation is really hard. It means building the trust of individuals, figuring out the workflows. All of that is very time intensive. It's absolutely critical. It cannot be done across 100 use cases. And so I'm unpopular in my organization because I say that, because they're like, but my use case is one of those hundreds, and I really need to get it done. And so I'd say, how do we create tracks by which we do unlock opportunity for innovation and piloting within safe guardrails, but then how do we elevate the use cases that really requires enterprise-wide attention?
Yeah, I think that's a great lesson. We're going to have you talk to the mayor also. He's going to tell us, go hard, go faster. We're going to say, but actually Dr. Yang said, do it thoughtfully.
We'll take all that energy and put it into a few things, you know, and that's what we realized at KP is we have all of that, those resources and that know-how. It just, when it gets distributed across 100 projects, you just get stuck with pilots that are doing great work. They just don't even have the visibility of yourself or the mayor to understand, is this even successful? Let's scale it. And so I would say we do need an all-in commitment, but we're better served by doing it on a few smaller things than we are doing it across a wide range of activities.
Yeah,
Could I use this as just an opportunity that the case study that was just presented really shows when we think about like responsible deployment, some of the key attributes, use cases, right? We're not adopting technology per se. We are looking at use cases where we think a particular technology can change people's lives, right? Whether that's your employees or the people that you serve. And my guess is, given that you're a frontline clinician as well, that the way in which the problem, particularly the scribe problem, was surfaced was probably in conversation with frontline workers who actually understand the challenges that they face, right? You are not bureaucrats, you are problem solvers, right? And you are the way in which can identify the problems. And then, of course, we need to look at the data and understand the way predictive models or Gen AI models work, right? We need some technical experts to also help us understand whether or not that problem is kind of AI appropriate or AI ready. But those use cases are the things that are going to have real impact. 2, Kaiser has the luxury of being a learning healthcare system, right? It is both a place where we deliver services. I'm a Kaiser member, I love Kaiser. He did not pay me, nor did Kaiser. But they are doing research all the time. And it means as a patient, sometimes I get ready access to things where there isn't a lot of already like, full-blown agreement across the community that something's going to be good for me, but because Kaiser is routinely doing research, as they are treating patients, they have a deep understanding and often an incredibly nuanced across like different segments of demographics about exactly which things are going to work well for you. And that allows them to do what one of my areas of research has been with healthcare systems too, through something called the Health AI Partnership. Looked at basically, I don't know, something like 100 different healthcare systems and looking at the ways in which they were adopting AI and what sorts of responsible AI practices were emerging. And this silent testing, right? Looking at how we normally would deliver care and how we would have, this AI implementation would have changed our decision-making. And doing this Monday morning quarterbacking and A/Bing and seeing which would have been a better outcome, and like, oh, this, actually, that would have been a bad outcome, and so what about our data or our model is leading us in that direction, given that these other 90 recommendations were so positive and would have had such good impact, and doing that really careful A/B kind of testing and evaluation is incredibly important, and doing it in silent mode, right? You don't necessarily want to be testing in real time on real people if you haven't yet tested it in some more lab-like setting. And then finally, public participation, right? That Kaiser is clearly both getting the engagement and feedback from their doctors, and I assume nurses and other staff, and attentive not just to like, is it changing an outcome? Is it making people happy? But it's a socio-technical intervention, and it's changing a lot of things, right, that humanize the healthcare delivery. And that's not something you're going to see in a metric. It's something that you actually need qualitative, different kinds of research to surface. And those are incredibly important in a place where you need trust, right? There's nothing that is going to undermine anything a city agency does than people feeling like they're being done to rather than worked with. And this sort of engagement is just incredibly important. And then the last one I want to say is transparency, right? And the consent, the disclosure, the use case inventories, I think they're often viewed as this really annoying, busy work of compliance. But what I want to say is they're an opportunity for you to tell the public how you're using AI to do their work and the delta. Like, how is it changing things, right? Like hearing that a predictive model saved 500 lives. We're like, okay, you know, you're making good choices. And I think we need to think about transparency as a key element of both getting people excited about the ways in which technological innovation can deliver on big public goals, like reducing deaths in the ER. And we need to show them we're doing it responsibly, show our work, not just platitudes. And so I think this was just such a nice case study to illustrate.
Thank you. I do want to just build up first. Yeah. A lot of very kind things you said. But just, you know, around choosing the use cases, you know, a simple rule of thumb is for us, the ambient scribe was such an obvious use case because our doctors were going and spending their own money to buy these technologies. That's how much they wanted it. And so it was easy for us. It was actually a win for all of us because we were able to then bring an enterprise approach to say, okay, instead of you going and buying all your own technologies, we hear the need for it. We are going to use our economies of scale as a large organization to drive an enterprise procurement process. We're going to be able to select among the best vendors. We're going to be able to throw all of our institutional controls behind it. You know, compliance, privacy, legal, you know, making sure that patient information is protected. And then we're going to do equity, yep. And then we're going to do quality assurance testing on that tool. And so instead of having 12 tools in the wild across our organization, we had one tool. And so we have a market like Southern California where we have 5 million members, or Northern California. The level of learning, the learning health system, means that we can then apply those practices and lessons learned to Hawaii, which might take 9 months to learn those same things. We can learn it in 2 weeks because of the scale. And so you know, a lot of the latent demand was there. What we did is we took it as an enterprise and we delivered a service and a product that really delighted people. And so if you're looking for the use cases, they're already out there. They're obvious. Like, where are people spending their money, right? And you may be thinking, oh, we need to stop them from doing that. No, it's actually, like, all of those workarounds are opportunities for you to explore and to better understand.
And let me just say, I think public servants are amongst the most creative employees because we have to figure out how to do a lot with sometimes tools that don't really help us get our jobs done. And so I just want to say that starting from the pain point of how we do our work and from people who do the work is a huge, huge takeaway here. We shouldn't be applying technology just for the sake of it. It should come from what is the problem we're trying to solve from the people who are doing the work. And so I think that's a big takeaway. I want to turn the attention a bit to you, Derek. You've done a lot of work at RegLab with a lot of different municipalities and different entities. Similar to what Daniel just shared with some of the use cases, what have you seen as other kind of use cases across different jurisdictions that you think have been deployed with success or have held great promise?
Great, yeah. So using the same framework, maybe I'll share 3 other use cases that are really informed through public sector engagement that our lab has done. So one is what has been mentioned a couple times already, but our work with the city attorney's office here to exhaustively search for reporting requirements. And I'll leave more to be said in the next session for sure, but sort of at the high level, 16 million words in the San Francisco codes and resolutions, and there are often in regulatory reform cases in which you need to just kind of look for needles in the haystack there and then do something about them. And attorneys in David Chu's office were literally just spending hours and hours doing manual keyword searches and then getting way too much stuff and still having to spend hours and hours sifting through those. So that was the core kind of time capacity issue. And so we developed an LLM-based tool to be able to exhaustively do that and get to a pretty good shortlist that then the attorneys could look at and verify. And that process really quickly got us to over 500 of these requirements for, say, a member of an executive branch to report something in writing to a member of the legislative branch. And having done that, we also could get the temporal component and see that it had like doubled in the last 10 to 15 years. So it had never really been put together at that scale, and so you'd imagine that would lead to maybe some kind of reform-based reactions and thinking there. But very importantly, from the kind of thoughtfulness and responsible perspective, that didn't just go straight to kind of deciding which ones to potentially do something about. The city attorney's office went through a really careful process with departments and maybe interacted with many of you in the audience to say, well, here are the set that our tool created as a shortlist, but you tell us, A, which ones are you actually doing, which ones are taking time, and which ones are really, really important to keep and that you would make a strong argument for, but maybe there are some that you would recommend are amended in some way. And so that thoughtful approach was really critical in the concept of quote-unquote humans in the loop here, right? So then that process, which happened earlier this year, led in June to David Chu introducing an ordinance to delete or modify 174, which is over a third of the ones that we had found. And I believe that's somewhere in Rules Committee right now. So I think the core insight there is really kind of this idea of capacity improvement, what kind of time saved there can then be reinvested in other things, and that's been already described in many helpful ways already. But also remember that there's a layer of like peer effectiveness, right? Like that process using an LLM approach might have just caught things that attorneys might have otherwise missed, and we've seen that in a lot of different contexts as well. So in what ways can the use of AI in particular cases actually augment the quality and effectiveness or the equity of what you're doing? So the second work is also in the Bay Area, but was around racially restrictive covenants in property deed records. There's statewide legislation, AB 1446, that led to requiring all 58 counties in the state to find and document and redact this type of just really vile language and that are still in records. And that's a massive task. Maybe underappreciated just how much implementation challenge that would be for relatively resource-constrained assessor recorder offices. In Santa Clara County specifically, there are like 24 million of these property deed documents. LA County, subject to the same requirement, contracted out to a vendor, an out-of-state vendor, to do this over 8 years for $7 million. We worked with Santa Clara County to do that for like $300 over 6 days. And the absolute key was that we designed and we took an open model and we trained on the like tens of thousands that they had already very meticulously done by hand.
Derek, I don't know if you knew, I was the assessor recorder here. So that's where it came from, you.
And so we're working with Joaquin Torres now and other counties to scale that. So I think that one speaks for itself in terms of the massive time and quality implications there. And a third last quick mention is, as you mentioned, my degree is in civil engineering, so we do a lot of different types of projects. And one is potholes. It's not yet in San Francisco, but it's with the city of San Diego. And they have sometimes massive backlogs with repairing potholes. They have thousands of potholes in their backlogs after rainy season. And so there's a pure opportunity, as Daniel was mentioning, like not even AI, but just pure kind of data science, machine learning to optimize their routing systems. And so we were working on that first. But really the bigger insight and interest from the city, as I'm sure exists here as well, is the equity dimension. A lot of these pothole repair kinds of systems, these civic services, are driven by a kind of first come, first serve, 311 approach. And that is great from a participation perspective, but what if that might be biased compared to what the actual coverage of potholes or other issues are? And that was definitely a challenge in San Diego. And so we were really kind of doing this multi-month partnership to look at computer vision using any number of imagery sources, including, say, just Google Street View, to see, can you find potholes through that imagery? And if you were to integrate a kind of 311 and computer vision informed system into the way you actually go out and repair potholes on a day-to-day basis, how does that change the neighborhoods you're actually spending time on? Does that lead to a more equitable result? And that's still a question to be answered through a rigorous approach, but we're doing that in cities in California and excited to expand that work if it really has these equity outcomes we're hoping for.
That's super interesting. And so just a little bit more on that particular project. It's in flight right now in San Diego. Yep. What other jurisdictions are you in on this pothole work?
Well, we've been talking to, we've been exploring this in the Bay Area as well, and particularly in areas that Waymo has coverage. There's been conversation on whether Waymo itself has imagery data that is also maybe filling gaps here, but no other active cities in flight yet.
Thank you. And I think just turning for a minute to Deirdre, I think you mentioned this in response to Daniel's case study, but can you talk a little bit more about what do you think it takes to make sure that we're maintaining the public trust in this process? Because I think some of this is, we talk a lot about, pre-identifying what our risks might be, really putting in place rigorous ways to test it on perhaps not going live yet on certain things, but kind of testing whether it's really working, ways to kind of mitigate the impact if things don't go right. But I think that there's also a public component. We all engage with the public. Our constituency is very engaged. There's a lot of questions about privacy concerns and other things. So can you tell us a little bit about how you think about those major things that we really need to keep in mind as we're thinking about deployment? How do we maintain public trust in that process? Because once we lose that trust with our employees, with the public, then I think it's much harder to come back out of.
Yeah, I hope we, given time too, I hope that I hit on at least some of them in kind of teasing out some of the more transcendent issues from Daniel's case study. But I would highlight a few others that I think are super important. Sometimes people think that responsible AI means, we have to have lawyers and layers of compliance, and that's what responsible AI. And responsible AI is having a vision about how technology, AI, is going to improve people's lives, and making sure, as Derek was just saying, it improves everybody's lives, right? That equity dimension, and it doesn't have any ancillary, unintended, although often foreseeable, impacts on things like people's privacy. And there are kind of three top-level things in addition to kind of what I talked about before that I want to emphasize. One is being really transparent and clear with the public about why you were trying to do this work and that it is for them and it is designed to help them. And at a point in time when people see their data and technology being weaponized in ways that undermine not just their livelihoods, but also their understanding of what it means to be an American, it is incredibly important for you to be really clear with the public that you are using technologies in ways that are designed to solve their problems, to empower them, to humanize services, right? And to make sure that the government works for everybody, right? And so just being really clear about what is the vision that you are driving towards is important, and you gotta say it over and over. And I wanna emphasize that one of the ways you can do that is through a use case inventory that isn't just a compliance exercise, but is an advertising exercise, right? About the work that civil servants and elected officials are trying to do for the public and why it is important. Second, your lawyers, your privacy team, your civil rights or equity officers, the folks who work on digital accessibility, those people need to be at the table when you're designing your system and when you're designing your evaluation metrics. Right? If you just leave them to the end, you're gonna do a lot of work, and then they're gonna be like, sorry, there are 3 problems here, and if you'd invited me in earlier, we could have designed this differently. So I'm just gonna take the pothole example, right? You can imagine lots of people are concerned. Oh, they're capturing images. Images of what, right? Are they capturing images of me? Are they capturing images of my children? Are they gonna be able to follow me? Is ICE gonna access the data, right? Like all of these sorts of concerns. And if you bring in your privacy and equity people and your accessibility people in early, they will say, well, you know, we can actually make sure that we use a bunch of technologies, just technical measures, as well as like practical choices. We're gonna be focused on the street. We're not gonna be looking up. We're gonna blur any face that happens to come across our camera. We are going to delete everything other than blah. If you remember, the technology that we use in airport screening, the backscatter machines, at one point they were called the naked machines because they literally were showing images of your body, and somehow or other they were like, well, we're protecting your data, and I was like, you're seeing naked images of my kids, right? And so what do we do now? There's an image that is a chalk outline and a little thing that says there's a heavy object here, right? Because that is a privacy-preserving design that supports the very important public service that needs to be done to ensure our safety, but does it in a way that respects people's dignity and privacy and limits the potential for information that could make people incredibly vulnerable to be misused or reused, right, in ways that they don't anticipate. So bringing those people in early is incredibly important. And then we talked about this kind of silent mode evaluation, but I think one of the other things that really shown in your presentation of the different case studies is you have to continuously evaluate, right? That people respond to systems. So the pothole reporting, right, that we normally use, 311 or other things, those don't start out inequitably. They end up producing inequities because people who live in my neighborhood are like, oh, there's a pothole, can everybody call? And I'm like, no, please don't do that, right? Because basically the signaling effect of my noisy, predominantly white community is going to increase our share of the services in a way. When I used to drive to my kids' soccer game in East Oakland and hit 300 potholes on one street that no one was calling about because it wasn't their street.
I think I live on that street.
Yeah. Right? And so like those systems don't start off necessarily inequitable, but if you evaluate them over time, you see the way in which they evolve as a socio-technical system with these feedback loops can produce horrific inequities in whose needs are served. And so that ongoing evaluation helps you stay true to your mission and stay true to the city's values.
If I can just build on that, I love those principles. You know, just to maybe make it real, one of those concepts, back to the use case around ambient scribes, it's the same tool, but it's what you do, like what are the objectives of what you're trying to achieve through that tool, right? So ambient scribes, as I mentioned, 2 big issues we're grappling with in healthcare. One is workforce burnout, and the other is access. They're both really important. So you can imagine, well, we're using this tool, if we're using it for access to say, we have a shortage of people that are getting into clinics, we see that you're saving time through using this tool. We would love to give you another patient to see every day, right? You can imagine it's a completely rational thought process, but how demotivating would that be to the clinical workforce? You know, that you've finally given us something that works, that we like, and now it's tied to more productivity requirements. And as a voluntary tool, people are going to vote with their feet. And now they're even more frustrated at you because you've taken away something that they really like. And so we made a very intentional decision. Access matters to us, but what matters more right now, and what matters more for why we deployed this, is clinical workforce, the benefit of the clinical workforce. So we're not going to tie it in with productivity gains, right? Again, it's not the tool, it's the decisions that leaders make around what are the KPIs you're driving for through use of that tool. One builds trust and one destroys trust.
Yeah, really great point. I think we want to open up some time for questions, but before we head into that, I do want to ask you kind of one question for everybody on the panelists, and it is, you know, across the city, this is the most amazing institution, I think, to work for. We do everything from healthcare to public safety to buying things to planning for our long-term needs to taking care of animals. I mean, you name it, we do it, right? And so the use cases and what people do is really broad. So thinking about that kind of organization here for a moment, and all the departments that actually have to operationalize that, what are one or two things that you think that we can do to start our journey down this path responsibly?
I'll start. I'm not going to give you a specific answer, but one of the things we think a lot about are patterns, right? So I've reviewed now 250 different ideas across our organization, and what I see is recurring patterns. So for example, what Derek mentioned is using a large language model to be able to extract complex information in a structured way. Or I want to have a conversation with our data, right? So, hey, I want a chatbot because I want to be able to quickly pull up our HR policy on how much I can spend for lunch when I'm traveling. That, we call it, you know, RAG, Retrieval Augmented Generation. It's essentially a mechanism by which individuals can have nuanced conversations and pull contextual information from data. So instead of solving that use case for this, for that, say, from a technical perspective, how do we build a utility platform that can solve that use case with the appropriate guardrails built at the platform level for then 50 use cases that fit that pattern? So that's one way where you start to unlock innovation, is you really embed the guardrails at the platform level, and you build utility platforms for patterns, and then you start to deploy that pattern across a wide variety of use cases.
One thing that we haven't talked about is where staff are kind of located. And I mentioned, you know, my involvement in the AI Tech Talent Surge. We were building off lots of investments that had been made during the Obama-Biden administration and then again in the Biden-Harris administration to build out centralized, easily deployable groups of experts that could help do the testing and evaluation or the design work, or had the, you know, equitable data or privacy lens that you really need to think through some of those issues. Every agency is not going to need that full stack team on a daily basis, but they do really need them when they're thinking through a design and putting together their evaluation methodology, et cetera. And so having both embedded staff within the agencies who have to have some ownership along with the people who are the service delivery leads, right? You need a team that really owns any given deployment. In my healthcare research, people said it's like a pet. Like, you know, you need to be really clear that people own it and have to take care of it and manage it, right? And I loved that. But you need these expert teams that can be deployed to really help when you're building out the system and doing the evaluations. And no agency is necessarily going to have the staff and budget and, frankly, need for those people all the time. And so you need to think about both distributed, embedded staff, and some centralized team. And I'm looking over, right? I think the folks in the room here, understand on the emerging tech backside, the real need for that deep expertise that can be deployed in a way that really helps each agency when they need it most.
I'll maybe leave us with a really practical version, maybe something I would even do within my teams at the Reg Lab. So I'm curious just of your teams within your departments, who's ever done a time diary, just hour by hour, what all your employees do within a week? Okay, so some of you, but sort of conceptually just imagine doing that for a week and then getting some kind of categories of big things that people spend their time on, writing compliance documents, doing, really nitty-gritty case fact-finding, meetings, et cetera. So you get some of these buckets. And then the size of those buckets from hours will naturally be one measure, right, of just how much time you're actually spending more or less in some of these categories. But then the frontline staff, your team itself, will be the best to kind of subjectively judge each of those categories by how worth it or not those areas are. So just imagine roughly a 2x2 matrix that you can be sort of populating these bubbles. And I think the lowest hanging fruit thing to start with is just on some top corner, there's the things that you're spending lots and lots of time on that are probably not really worth your time. And I think those then deserve some really creative brainstorming with your team. And then, AI experts and support teams can be there to think through particular technologies, but really just how do you save time with AI potentially in those areas. And maybe you'll find that you can't, but then if you do find some savings there, then it makes potentially a lot of sense to just reinvest those time savings at the other end of that matrix, all the things or some things there, which are very, very much worth your time, but you get almost no time to do it all. And those conversions, I think that's a case-by-case discovery process in each of your teams. And I like the idea of letting that kind of organically happen at some scale, where the real work is understood. And that exercise can be kind of evaluated again and again.
Those are really great takeaways. Can you all join me in a great round of applause for this great panel? I've learned so much already from just a quick conversation from these experts here, and I hope that we can continue to engage with you as we go on our journey. But I'm wondering if we might want to open it up for a few questions. Jane, I'll turn it over to you to direct the microphone. Any questions?
Hi, thank you so much. Just firstly, wow, fantastic presentation, and I really like how you've grounded in the human element and service delivery, something we all do. Eli Gillardin, Director of the Office on Disability and Accessibility. And Derek, I'm thinking about the potholes and the connection between potholes and accessibility of the built environment. And I'm curious if your study in San Diego has explored broadening that work into overall accessibility, whether it's sidewalks, curb ramps, or facilities. Thank you.
Really appreciate the question, yeah. So our kind of code name for the project internal is CVCS, which is Computer Vision for Civic Services. And so we are interested in not just starting and ending in potholes, but really going to the deeper realm of accessibility and safety. But it's just gonna be a very kind of case-by-case basis. And we know that we're interested in looking at Google Street View because of its ubiquitousness and its potential scalability across cities and regions, but that's going to be a view from the car's perspective, right? And so that's going to center and prioritize certain things, which may, on their own merits, be really important to address, but it's not going to be the be-all and end-all of thinking about road safety and pedestrian accessibility, et cetera. So I think we're gonna have to really be creative and thoughtful about if we really wanna tackle curb cuts, whether they're actually correctly maintained or not, sidewalk defects, et cetera, bike lanes, then sometimes the Google Street View image, which has its own merits because of its accessibility as an image source, might have fundamental limitations, and we might have to explore different trade-offs with the cost and privacy concerns of procuring and thoughtfully maintaining other types of data sets. But I think there's a lot of opportunities to be creative there. I'm thinking about ways to point cameras in really focused on these urban assets on all kinds of public vehicles that are already street sweeping and doing the rounds, and really just be thoughtful about these particular use cases as we go.
Awesome. When you're ready to talk to San Francisco, let me know.
I was thinking about the curb cuts, and we can put them on possibly when the street sweepers are coming through, you've got no cars blocking the way to see what the curb actually looks like, for example. So I think this concept of how do you deploy the technology, what's actually out there that actually gets you to the thing that you're trying to solve is important. Do I have another question?
Right over here. Hi, my name is Rebecca. I'm with the library. And I have a question that's probably very a librarian question. Do you have any articles, research, papers, some primers that you could recommend to us about work with the public sector that can help those of us who are not, thinking AI all day and are really interested and want to get involved and want to plan and want to do it the right way and kind of see what's happened out there? Do you have any suggestions for us?
There's certainly many research articles, some of them labs, some of them use cases in the wild, which I think are particularly important. I will also note, one of the things I did when I came back to Berkeley from DC was stand up an executive fellows program, and I had the head of digital accessibility, who was part of my team at the Office of Science and Technology Policy, and the chief AI officer from the Department of Homeland Security, and the president's advisor on science and technology, a whole slew of experts who have been translating the knowledge that they gained through that experience into things that we hope will be useful. And that's everything from a field guide to public data, to a very lengthy idea about digital accessibility and building a more accessible future, and many things about organizational arrangements to use technology boldly for the public. And those will be coming out this spring, and I'll make sure, because they're from people who've been in your shoes and walked the walk, and I think often their knowledge just gets left on as tacit and on the floor, and bringing it out and surfacing it for other public leaders seemed really important. So I'll make sure those get shared.
Thank you. Did you want to add something?
Yeah, thank you for the question, Rebecca. I'm a book fanatic, so we do a lot of book club kind of stuff in the Reg Lab, so I had to share my list as well. For kind of public sector, thinking about AI and other kinds of interventions, I would start with Recoding America by Jen Pahlka, if that hasn't been read before. Abundance, Ezra Klein and Derek Thompson, we debated that very recently within our lab. Michael Lewis's recent book, Who is Government?, which is a bunch of essays about public servants. And then, of course, Dr. Fei-Fei Li's book is a great one as well. And then I'll just quickly add that John King just wrote a book called Portal about the ferry building, which I think is great. And there's a section about that. It's just all about for how long the public was just okay with the double-decker freeway in front of the ferry building, and just thinking about like the inertia of like big picture changes that we could make for the better within our cities. So I love that book too.
I might just add one more book that's influenced me. It's called Weapons of Math Destruction. And it's all about traditional machine learning, data science, and many case studies of kind of it gone wrong. So well-intentioned, problems are solving, didn't think through a lot of the implications, ended up harming people, driving inequities, et cetera.
Fantastic. Do we have any questions from this side of the house? It's like, the concert's like, how's this side of the house doing? Anybody over here have a question?
Carmen, we have all those books, I checked.
Okay, we're going to get a list to everybody here.
Hello, my name is Melanie. I work for the President of the Board of Supervisors, and I'm curious, as we've worked actually very closely with Carmen's office on a lot of things over the last year, where politicians seem to kind of, not intentionally, sometimes well-intentioned, get in the way and make things more complicated and harder to deliver services to the residents of San Francisco. So as we're thinking of like AI and technology deployment, you're talking about like the David Chu's, effort that's stuck at the Rules Committee. How can we think about bringing politicians along for the ride and making sure, although they're not the experts here, they are listening to the experts and have the right tools at their fingertips so that they can make informed decisions around AI?
I'll just quickly start by saying...
Just quickly on that point, did you know that in contracting, over the last 4.5 years, this city has passed 22 pieces of legislation changing the rules around procurement? So, I mean, it's not good, but... but to say there's a need to think about how we bring our leaders along.
So I'll quickly say that the legislation proposal to remove reporting requirements, the meta irony is, I would say that that's predicated on the idea that some reports that staff are burdened to do or are burdensome and could be used better time on. But I'll make a caveat for what was mentioned, which was the transparency aspect of AI. If that looks like writing stories and telling thoughtful stories about how you've experimented with and hopefully found success cases using AI within your teams, those are reports I can get behind. And I think telling those stories clearly and thoughtfully and making sure they make their way to elected officials will help, I think, change the narrative, which can often really miss those opportunities for effective use of AI in government.
My experience with elected officials is always make it their idea. And, so go and build those bridges and make people feel, set the table. You want them not just to be like receiving your work, but to be like excited and calling you and wanting to know when it's going to arrive. And, engaging people early on and getting their feedback, and also understanding the ways in which it's going to be received by the stakeholders to whom they are responsive. And so, just to give you an example, in the White House when we were doing the guidance through OMB on the responsible government use of AI, one of the things that was incredibly important was many civil society organizations, that was their top priority, and they communicated it, and we made sure that their desire for that was well known throughout the White House and also throughout the agencies. And so when we were finally had a document and every agency had a chief AI officer, we brought those civil society leaders in to actually talk with them and about the importance of the work and why it mattered, and that they were part of the accountability ecosystem, but that they were really excited about this work and wanted to see it prioritized. And we made sure that the civil society organizations and others knew who the chief AI officers were and had their contact information so they could reach out to them and maintain that relationship so they feel some sense of ownership. So those are things that I think they're a little transcendent, but that's the work of building a constituency for your work.
I would just add, I might reframe as how do you ensure that bureaucracy doesn't get in the way of impactful innovation. It's something that we experience a lot of at KP. We're a big organization. We've got a lot of bureaucracy. I'm part of it. And back to my original point of if you can really identify the 1, 2, or 3 things that really matter, right, and drive enterprise alignment and prioritization around those things, one of the things that we have to do is we have to expand our risk tolerance around those things. Mm-hmm. And so if you go to legal or compliance or privacy, their job is to prevent anything bad from happening. And so they're paid to be conservative. But sometimes what they're not seeing is the potential benefit. And that is really for the business to own, making the case for that benefit. And so there are definitely, when you start to narrow the use cases that really matter, suddenly everyone's working together. Their job is not to slow it down or to block it. Their job is to engage, very, very similar to what Deirdre mentioned around kind of bring responsible AI as a component of the design of it, as opposed to having them as checkers and, hey, you should check this or do that. And so, again, you can't do that when you've got 100 use cases you're managing, right? And so I think the role of leaders are to identify the few things that should really be done and then activate, because those compliance legal people report up to these individuals, are supporting the organization's mission. And so it gets them on board, and it really gets them not bending the rules, but it gets them engaged at an earlier place so that the end outcome, we get there faster, we get there more responsible.
I want to echo something incredibly important. Sometimes people think you do a risk categorization process so you avoid doing things that are high risk, and that is backwards, right? Just because it's high risk doesn't mean you shouldn't tackle it. It means that you need to really do the work, because often those high-risk things are the ones that unlock incredible, important benefits for the public. And it just means that you need to bring your stakeholders along. You need to really have a robust process. But that's where the big wins lie. And so don't think because something's risky that you shouldn't do it.
Okay, Dr. Daniel Yang, Deirdre Mulligan, Derek Oyang, thank you so very much.
Let's hear it for these panel speakers one more time. Thank you so much. Thank you. Thank you so much. I kept standing over there and nodding to everything they said. And like Carmen said, I also learned so much. I'm going to go back and watch this and take copious notes, or maybe AI will take the notes for me. And now we're gonna do something that's low risk. You're all gonna be able to get up, stretch your legs. There's water and coffee outside in the Latino room. And those of you who are watching us online, I hope you'll stand up from your desk as well and stretch your legs, take a break, come back in 10 minutes. Thank you so much. government while protecting transparency, accountability, and public trust. We're joined by two leaders who are already doing this work on the ground. I have the honor of introducing City Attorney David Chu. His office is pioneering responsible AI use in San Francisco's legal and governance systems. And Professor Daniel Ho, director of Stanford's Reg Lab, they've already partnered with countless cities, counties, and also the federal agencies across the country to apply AI to real implementation challenges. Please join me in welcoming David Chu and Daniel Ho for our Fireside Chat.
Good morning, everybody. Thank you so much for convening. And by the way, Jane, thank you for putting together such a festive holiday atmosphere. Let me just start by thanking all of you for being part of the future of our city. And a little by way of background, you may be wondering, why is the city attorney sitting up here? I should tell you that for about a decade before I became an elected official, I started and ran a public affairs technology company that was focused on how to facilitate engagements by constituents with government. And then I'll fast forward. When I turned on my computer, and this is in 2009, and discovered that my email system was Lotus 123. And I also discovered on that day that there were 7 different email systems in the city and county of San Francisco, which meant that as the president of the Board of Supervisors, I could not easily communicate with different folks in government. I also discovered that our city had dozens of data centers when typical best practice suggests that we only needed a few. We had literally thousands of contracts with hundreds of vendors, and there was just no consolidation. And so I decided to join the Committee on Information Technology as the Board of Supervisors rep to that. And I remember at that time in 2009, we often talked about how technology was partying in San Francisco as if it were 1999, reference to the old Prince song, and how we need to move things forward. And I'm proud that there were a lot of things that we were able to do over the years to get there, but here we are today. And I do think where we are at this moment, many aspects of government, we are a little bit behind where we need to be. And just so appreciate all of you taking part in this, all of the speakers thinking about what the next steps are. Let me also mention one other thing. Obviously, we are going to talk about work that Dan and I have done sort of in this space, but my office, we are working both on how do we move forward the use of this technology in positive ways, but also how do we address challenges with this technology. And I'll give 2 examples on the front end of some of the dangers. We were asked by the SFMTA when Cruise was on the streets of San Francisco, and there were a bunch of issues that happened around Cruise, to think about what are policies that we need to put in place to ensure that new technologies on the roads are safe. On a totally different note, I got a text one weekend from a number of top litigators in my office who happen to be moms of teenage girls. And they shared an article about how AI has been used to create deepfake pornographic images of women and girls all over the world, hundreds of millions of images. In my office, we brought the first lawsuit in the world against 16 of the largest AI deepfake companies that were essentially abusing women all over the globe. At this moment, we've actually shut down 11 of those companies. But I say this because we have to be very clear-eyed in how we move forward on this topic. And maybe just as a teaser, what Dan and I are going to discuss today is kind of 3 use cases of how we've worked together. One in the topic of racially discriminatory property covenants. The second having to do with our efforts as a city to streamline commissions. And then the third, how do we grapple with the hundreds of reports that San Francisco city government is required to put out every year. But with that, I want to turn it over to my good friend Dan for some introductory comments.
Well, thanks so much for the chance to join you all today. I, too, remember Lotus Notes way back in the day when I started my faculty position. But maybe just to build a little bit on what David said, we're in this really interesting moment with generative AI. I'll just give you a story, which is right after ChatGPT was released, one of my colleagues who had a daughter around the same age, 5 years old, reached out to me and said, Dan, you have to try this. We've used a combination of ChatGPT and DALL-E, the sort of image engine, to completely change how we do bedtime stories. We do an illustrated, story based on a prompt that my daughter comes up with, and we create an entire children's book in the evening. You have to try this. And I did. I tried the exact same prompt that he had used, which is, tell me a story, a children's story about a girl named Louisa that ends with a twist. And in contrast to what my colleague Jacob got, I got the absolute worst version of Grimm's fairy tales. The first example was Louisa went to the store with her mom, wanted to buy a yellow dress. The mom refused. Louisa ran outside. A car swerved to avoid hitting her, killing a man. Louisa ran away, never to be seen again. That's this interesting moment we're at, where the technology both has the potential to completely revolutionize an institution, bedtime story time, but could also permanently harm a 5-year-old. And luckily, her reading skills were not advanced enough, so I stopped the story when I realized where it was kind of taking this dark turn. And in many ways, this is such emerging technology with huge benefits, but also really significant risks, as David mentioned. And so what we do at Stanford Reg Lab is really build out partnerships with government agencies to think about really understanding the most impactful and responsible use cases where this technology can really help the public sector. In the earlier panel, there's a lot of emphasis on kind of responsible AI and transparency. And I guess I'll just give you one anecdote, and then we'll get into the 3 use cases that David mentioned. But our team had been in a collaboration for about 6 years with the IRS around how to tackle the annual tax gap of around $500 billion. And we both helped in terms of building out some tools to spot forms of tax evasion. But one of the things that we also did in the process is to actually understand, given lots of anxieties around the ways in which this technology might exacerbate demographic disparities, it also required us to figure out what exactly were the demographic implications of tax auditing. And what we discovered was not in the fancy AI system, but in the legacy system, there were really disturbing demographic disparities. Our team was the one that discovered that black taxpayers were audited at 3 to 5 times the rate as non-black taxpayers, having very little to do with underreporting in legacy systems. And so oftentimes you think about that as a story of sort of algorithmic bias, but part of it is that sometimes the transparency that we bring into these projects gives us a level of oversight over existing systems that we might actually not genuinely have had before, and that triggered a kind of overhaul by IRS around how it audits around the earned income tax credit filed by over 20 million Americans annually.
All right, now that we've started in those dark places, let's move on to the light. So there was a question that was asked at the end of the last session about the politicians and the elected officials who might not always get it. And I want to address that for a moment. I used to be one of your supervisors. I was in the state legislature. I have probably close to 200 local and state laws that I have authored. I have probably voted on thousands of others. And as a former legislator, very proud of our work. That is how the politicians think about ourselves. I will tell you, I'm now about to start my 5th year as your city attorney. The number one thing I think about every day is how the politicians, particularly the legislators, we may not always get it exactly right. And in particular, thinking about how a law is implemented is not forefront to what a lot of elected officials think about, particularly those who are responsible for rulemaking and lawmaking. Our first use case is really in that example. Let me just sort of lay out the problem set, which is, many of you know, if you are a first-year law student or if you know anything about property covenants, you may know that for many, many decades, stretching back over a century, all over the country, but particularly in California, even including in San Francisco, you go into property documents, you will find covenants, conditions that are racially discriminatory, that are trying to prevent African Americans from living in certain neighborhoods, Asian Americans from living in neighborhoods, Jewish Americans from living in neighborhoods, literally sprinkled throughout millions of pages of property records, you will find these conditions. In my last year in the legislature, in 2021, having learned about this, I teamed up with a couple of my colleagues, and we passed AB 1466, which required counties and county recorders to essentially go through these documents and redact these truly offensive and discriminatory language, which of course makes sense. That being said, we didn't exactly think about how this was going to happen. And when you have, actually, I should say, probably billions of pages of property records and millions of these conditions, it's not that easy to do, as I learned from my good friend Joaquin Torres, who is our assessor recorder. So that was along the time when Dan Ho comes along, and I will pass it on to Dan to tell the story of where Stara took it from there.
Yeah, I actually signed one of these deed documents. It's just really striking when you look at how these documents are structured, because they are in the part of the deed record that is essentially about nuisances. So it says things like, there shall be a septic tank. There shall be no saloons on the property. Oh, and by the way, also no Asians, unless in the capacity of a servant. So that was the document I had to sign. We started a project, first in collaboration with Santa Clara County, and now really happy to say we're also working with Joaquin Torres here in San Francisco to get this done, because the recognition was that if you're just gonna have people manually read over these documents, in a single county like Santa Clara, that's 84 million pages. Until we started the collaboration, Genevieve was one of a 2-member team that had read 89,000 pages to find around 400 of these racial covenants. And so what we built out was really a general search tool to be able to sift through these documents, to take page images and basically drive the power of large language models to pinpoint it's exactly this paragraph or this sentence that is the offensive language. And I think Derek had mentioned it in the prior panel. You know, oftentimes the idea of using technology, the immediate thing is to let's procure some services to do this. And he mentioned the example of one county that approached a vendor and paid about $8 million to try to get this done over 7 years. But that actually understates the cost in the sense that keyword searches are a really, really poor way to do this, because what your staff will be left with is hundreds of thousands of potential false positives of any appearance of the term white corporation, white road, and all those terms, whereas that's the power of large language models to really contextually be able to identify with extremely high accuracy what the racial covenants are. And so in contrast to the 8 million in 7 years, I think we did it for less than $300 and are able to run across the Santa Clara County deed records in about 6 days. And really excited to be partnering with Joaquin Torres to actually have done this in San Francisco as well. And that's the real power and potential of this technology, is to take something that might otherwise take humans years and years to complete, so that even if David didn't quite think about the implementation plan, there's a way to actually get this done in a way that is not going to take 10 to 20 years.
And maybe a little coda. My understanding is I think Stara has run through about 15 million records right now within San Francisco, and we're also going through that process. But I also mentioned there still is significant work that has to happen on a human level, both by my office as well as by Joaquin's office, to get us to a place where we will hopefully someday have San Francisco records that do not have mention of said historic discriminatory language. One theme I just want to talk about is in every single engagement, we would think first from a staff standpoint of what is the problem that we are trying to solve, right? Focus on what's that real human challenge that our constituents want us to figure out, and then we engage with the technology experts, and then we come back. And again, there's a real collaborative process where we're relying on city expertise, staff expertise, and technical expertise to get where we're going. Let's go to the second example. There was an article in the SF Standard in 2023 that kicked off a massive political debate in San Francisco. Some of you may remember an article that said only one person at City Hall knows the answer to this question. And the question was, how many boards, commissions, and advisory boards are there in San Francisco city government? And the reporter went to talk about how he had gone to the mayor's office, to supervisors, to department heads, to the controller's office, the city administrator's office. No one knew the answer to this question. And I am really proud, I have to say this is a humble brag about my communications director. They came to my communications director, Jen Court, and she literally spent half a day by hand adding up numbers, and the number she gave to the reporter was 183. And you may know this kicked off a discussion where there were dueling ballot measures. Proposition D on the ballot of November 2024 said we're going to try to slim down these number of commissions down to 65. Proposition E said we're not prepared to slim down yet, but we want to create a commission to study the commissions. And I think many of you know, Proposition D failed, Proposition E passed, and we have had for the better part of a year a Proposition E commission. Well, so the first task in this commission was placed in our office to actually identify how many are there. And it turned out, you know, we knew my comms director had done literally a hand search, but there are 16 million words in the code. And so called Dan up and said, could you just do a little search and tell us? And it turned out we were generally in the right ballpark, but we missed a few. And that is, again, another example of just how this technology is helping to supplement what we're doing. And for the better part of this past year, there's been a major discussion about the streamlining of commissions, but we wouldn't be able to really know what the full universe is, all the data, without the STARA tool.
I think the next proposal is going to be to have a commission to study the commission on commissions. I'm joking. Just to give a little bit of context here, STARA is this general statutory research tool that our team built out really after our initial work on racial covenants to make it easier to sift through statutes and regulations in a very general way. And we started this collaboration really around this ballot proposition where really the first thing that the Commission on Commissions has to have is a comprehensive view of the number of commissions that there are. And I think we found definitely a few more. I think 32 additional ones that were just missed. They were sort of legacy commissions, many of which were no longer meeting, that are obviously good candidates for potential forms of streamlining. But maybe just the other thing I'll add here is that what I think is really important to keep in mind through each of these use cases is that it's really a collaborative process. So we did a lot to kind of benchmark and make sure, did we catch all of the ones that a manual search kind of surfaced? And yes, we did. And then let's actually see of the list that the 32 additional ones, it's actually a larger number, but which ones are actually relevant and fit the kind of definition because things that are in the city charter are not actually amendable quite in the same way and the like. And I think my favorite quote was from one of our collaborators on the city attorney's side who just sort of said, that this tool was, quote, outrageously helpful, because otherwise you're spending all of this time doing keyword searches through 16 million words of the San Francisco Municipal Code and associated resolutions. The other thing that was really striking to me, and I think it was noted on the prior panel, is that oftentimes when folks go through law school, I teach at Stanford Law School, there's this sort of idea that there are these search engines that make it possible for you to understand what the state of the law is. But when it comes to municipal codes, those often don't exist in these kinds of systems, and as a result are in pretty dated forms of search technology that rely on keyword searches that make it really kind of difficult to do a comprehensive scan like the one that was needed really for implementation of Proposition E.
So the third use case we want to chat about involves reports. Reports by government. And I see, as I say that, a couple of your eyes are glazing over. So over the years, I have been part of government now for 17 years. I have been asked by department heads, David, we have all these reports we have to do. I don't even know how many reports we have to do. Can you tell me? And when I hear that, one of the things I also think about is reports are often a way for policymakers when they don't know exactly the right answer for something, or they need to show that they're being responsive to the public by saying we're doing something about it, is they say, let's have someone do a report on that, or a second report on it, or a third report on it, or so many reports that we don't even know how many reports we have. So Dan and I, after the project around commissions, he asked, what's next? And I said, you know, it'd be really great if we had a sense of how many reports there are that are required of government throughout our entire bureaucracy. Can you figure that out? And he'll talk a little bit about kind of that work from his perspective, but we gave the task to him, and they came back with the answer, 538 reports, required every year by bureaucrats, by city staff to spend countless hours to push out. And what we did with that information was we then went to 100 different department heads and decision makers and said to the planning department, you have 52 reports that you are required to do. How many of these do you think are adding value that we actually want to continue to do? And we did this across all of city government. And it was interesting. We were told that 64% of these reports were reports that should continue, but 174 of these reports, 36%, are reports that are either outdated, and I'll give a couple of examples of that, or should be merged with other reports. So for example, we had a report that requires us to count the number of pedestal newsstands on the streets of San Francisco. You know those boxes where the Chronicle and the Examiner used to sit. We're supposed to count that. There's a requirement that every quarter we issue a report for the former redevelopment agency. This has been on the books for the better part of 80 years. And the problem is redevelopment went away in 2011. And so we went through this exercise working very closely with every department that's represented here today. We have put together an ordinance that is now currently pending at the Board of Supervisors to streamline this, and maybe I'll just end with this coda. There are many obvious reasons why we need to do this, but first and foremost, we don't want city staff wasting their time on reports that are irrelevant, that no one cares about. It's demoralizing to city staff, but it also means that we are not spending valuable city time and city staff and city brain power doing the things that matter. This is the sort of thing that gets the public upset about what it is that we are or are not doing. But now I want to turn over to Dan for your perspective on this.
Yeah, I think it was such an interesting collaboration in part because, you know, in a way, what we solved was the search problem of how do you go through the 16 million kind of words. But what was absolutely essential to this was this consultative process that the city attorney's office kicked off. And there are so many other avenues where this kind of a general search tool can be important. I think of when Ruth Bader Ginsburg was a Columbia Law School professor. She hired an army of law students to sift through the US code to identify all instances of gender bias in the US code. And that essentially formed the litigation blueprint for the Women's Rights Project at the ACLU. And there are so many code provisions that still are buried because until now, has been so difficult to actually sift through all of this. One example from the San Francisco Municipal Code is that the public health director, according to the code, has the authority to arrest any adulterer and inspect them for venereal disease. Probably not something that is exercised in modern times. You know, if we could use tools like this just to go through and kind of update and take out some of these legacy provisions, we could actually spot a lot of other things. The Washington Post dubbed the reporting requirements at the federal level as a kind of congressional black hole. You kind of put it in there, the reporting requirement persists, it's never taken out, and so they accumulate over time. So in San Francisco, where city staffing levels have not increased that much since 2000, the number of reports doubled since 2000. So the civil servants are asked to do more with less. And the question is, are all of those reports still worth it? And can we begin to kind of identify these forms of what I've been calling policy sludge to actually make your all's jobs a little bit easier?
So just to recap, and then we're happy to open it up to some questions. Part of how I view the possibility of these tools is really addressing the unbelievable complexity that is government. Over the years, as laws layer on top of laws, layer on top of laws, people forget what is 3 layers down, 4 layers down, and the ability for these tools to, again, figure out how many commissions there are, get rid of the racially discriminatory covenants, address reporting requirements. We wouldn't be able to do this work but for the technology. None of your department heads would tell my lawyers devote thousands of hours to finding these reports, but now that we have found them, we can actually do something about it. Let me just give you some examples of complexity that I think just, again, involves the layering of laws over laws. A $1.7 million toilet that was supposed to have been built in Noe Valley. Those of you from Rec and Park know it doesn't cost that much because you want it to cost that much. It costs that much because of the incredible number of rules and regulations that you have to go through in order to make that. It was not long ago that we had 9 different homeless outreach teams. It was not long ago that it literally took on average 11 months for a typical city department to go through all the civil service requirements to hire somebody. Just think about that. You have a desperate need. Someone has just left. You need to replace that person within your organization. 11 months for that process. If you want to open up a bakery or a yogurt shop, again, until recently, you have to navigate 15 city departments, right? So just thinking about the complexity and the way for technology to help us figure out how we can deliver, that is why we're all here. And frankly, if we don't figure this out, that is what leads to frustration by the public. That is what leads to the Donald Trumps of the world being able to implement the Doges of the world to come in and just take a wrecking ball to government. If we can't figure this out for San Francisco, others are going to figure it out for us. And maybe one other thing I will say is, again, if our goal is to make the kind of progress that we want, the kind of innovation that we want, we've got to think about how to tap into technologies that will help us do this, allow us to put our workforce and our human brains to the best possible and the highest possible use in actually serving who we're trying to serve.
I think that was so well said. I guess I want to say a few words just about the actual nuts and bolts of this, because so often this can seem so distant, right, of how to actually set up something like this. And to me, one of the real structural pathologies is that the way we have tended to think about emerging technology is that pretty much the only way we can do this is to purchase it through sort of procurement. And I think that is there's certainly really valuable use cases where that's the right path. One of the things we've really been charting forward at Stanford Reg Lab has been to think about ways to craft partnerships that really are kind of win-wins on both sides, because our perspective is so much of this is still emerging technology, and it isn't quite right that you can just buy the solution off the shelf to solve the exact problem that most burdens your staff. That takes a little bit more by way of discovery, takes a little bit more of a kind of collaborative ethos. In the way that Deirdre pointed out, it takes a way of thinking about bringing in personnel, right? I'll give you kind of one statistic from the recent AI index, which is that of AI PhDs, about 60% go into industry, about 20 to 25% go into academic positions, less than 1% considers a stint in public service. That is a really big challenge because government can't get AI right if government can't understand AI. And so one of the mechanisms that we really championed at the state level, which is actually available to San Francisco County, is the federal government has had these moments of innovation. And one of the vehicles, for instance, is something, an obscure statute known as the Intergovernmental Personnel Act. But what it basically has allowed federal agencies to do is to take academics and individuals from qualified nonprofits and much more expeditiously detail them to serve as if they are employees within the government unit. The thing that's been striking to see, and as a lot of our collaborations have moved towards states and localities, that states by and large have lacked a similar mechanism. The first director of the White House National AI Initiative Office was under assignment from a university under this IPA mechanism. And so one of the things that we worked on in Sacramento was actually to have a mechanism like that available for California, the state, and in turn, localities, because what we've done in a number of the collaborations here in California is essentially kind of figure out makeshift ways to have that kind of onboarding and collaboration be made a little bit easier so that what you're looking at is not a kind of 18-month process just to be able to get folks in. Procurement is a really big part of that, right? At the federal side, so many of these procurement contracts are written with the assumption that there will be a bid protest. And so what you're looking at is writing out all of the specifications ex ante, awarding it to the lowest cost bidder. You're going to have massive delays if it goes under a bid protest. So by the time that you actually get the project started, you're already in like the last generation technology. And that is not the way forward, at least for a number of these kinds of use cases, given the pace of technology.
Want to open up to any questions? Got a few right here.
You know, David, this is styled as a fireside chat. I'm not seeing a fireplace here.
We'll get that right next year.
Thank you.
We can hear you repeat your question if you like.
Okay. My name is Erin. I work for the health service system. I'm a well-being coordinator. And in all these conversations, I'm thinking about our members. I'm thinking about the employees of the city and county that I serve. And I think about the people that they are also serving who, unlike me, who is sitting in this room, excited about using AI to support them, may not have bought in and are members of communities that have been disenfranchised by our systems, and who might be fearing that AI is going to reinforce that disenfranchisement or cause further harm. And I'm curious if in your conversations and in the planning that you're doing, you're having conversations about how to market this to the public, how to market this to employees in a way that allows them to feel good about what they're doing and the way that they're using AI, and also means that they can share the information that you've shared with us today about how beneficial it can be.
I'll start. I mean, I think so much of this boils down to focusing on the right problems to fix. The wrong way to get AI into the public sector is that people have a hammer and they're in search of the nail, the place that you really start is, what are the things that are really burdening your staff? What are the things that are really challenging to kind of implement? That's why Prop E and AB 1466 are such kind of compelling examples. And oftentimes that has this lens of really thinking about how to improve the quality of services. I'll give you one example that we did with Santa Clara County in pandemic response. Santa Clara County, very early on, hired within a matter of weeks 1,000 contact tracers early on in the pandemic. A small number of those contact tracers were bilingual, but because of just the nuttiness of how the system was being run, cases were essentially being randomly routed to contact tracers, utilizing none of the sort of language capacities of different teams. And what we built out is we built out a system, a really simple system that basically brought in some information of the case reports based on census statistics to predict language needs of incoming cases. Right? There was no field coming in these cases that actually told you what the language needs were. And then we did a demonstration project where we routed people to a specialized language team. And what we showed in a randomized controlled trial was that that improved engagement by the community. People were much more willing to have that sensitive conversation with contact tracers and expedited the time at which you could actually close a case, because you weren't having to call in like external translation services if there were language barriers. And so to me, like really so much of this boils down to what are the compelling demonstration projects where we can think about restoring trust in how these services are delivered.
I want to echo a few things Dan said. You know, if you tell folks AI is coming, that sounds scary. If you say we use AI to strip millions of racially discriminatory covenants from your property records, or we are trying to figure out how city staff don't have to work on 170 reports and instead focus on your needs, that's a very different context, right? And I think one thing that's very exciting about this time period is every one of us is thinking, what are those examples where we can make that headway, and how do we pilot these examples in ways that are safe, ways that are within the law, ways that reflect our values, knowing that there are ways in which it could be used for ill, and addressing those things as well. I started my comments by talking about what our office has done to address some of the issues with AI, as well as some of the positive aspects of AI. And I think it's important to have those two balances, but if we don't experiment, if we don't try these things, we'll never get anywhere. So I think that is something we will all have to grapple with, and how we engage with the public. But I also like to remind folks there are so many everyday examples of how each of us are using AI on our phones, on our laptops, with various products and devices that we have. We're doing that already. And the question is just, you know, what are the use cases that are safe, that protect privacy, that are transparent, that are accountable, and how will this move our lives forward in better ways?
Final question.
Thank you. So take that even further. So how do you get from the staff member who is using ChatGPT on their phone for their work, how do you get that platform into the hands of the workers? Like we had OpenAI for 6 months. Not everybody had access to that. Now we have Copilot. You know, Dr. Yang mentioned, you know, developing their own platform at KP. So what work is being done within departments to bring those platforms to us to make our work more efficient?
One thing I'll mention, thanks to Jane and others within city government, a number of us who are department heads and at the highest level of government, we are going through a training right now in how we think about engaging our workforces in this work. To your point, within my office, I set up an AI working group that is made up of employees that kind of represent the diversity of work that we do. And their charge is what tools are out there, what criteria do we need to think about by the use of those tools. They're charged with also thinking about pilots. So we're not going to implement a huge department-wide deployment until we know that something works for a particular project and a particular team. And I think that incremental way of looking at things, evaluating it as we go, is is a much better way of going about it than taking 2 years to study a major deployment, implementing it for 4 years, and then doing an evaluation for another 3 to see if it worked, and by that time, we're 10 years behind. So I want to mention all that, but let me also mention one other thing that's specific to our department. Part of how I got inspired into this, not just because of work I've done in tech, but as I have conversations with other large legal organizations that are my comparables, so my fellow city attorneys and county councils around the country, but also big law firms downtown who are litigating cases against my office who are 3 or 4 years ahead in their use of AI. We have to do this to compete to some degree. So, but every department is different. But you know, I know with Mayor Lurie and many of us, we're really pushing everyone to think about what are appropriate uses, what are less appropriate uses, what are the guidelines and values, so that we think about this in smart ways.
I'll just add 2 things to that, which is I think you'll hear from my colleague Fei Li later on today. And one of the things that we've really been championing has been a kind of public data and compute resource that on the federal level is known as the National AI Research Resource. And in California, there's some legislation around that has come to be known around as Cal Compute, really to be able to provide more public sector resources. And I'll add that actually, you know, we often think that Anthropic and OpenAI, which build great models, are kind of the default to go with, but there actually is a thriving open source ecosystem in this world as well that oftentimes has a really substantial cost differential. See the $8 million versus $258 on the racial covenant restriction side. The second and last thing I'll just leave you with is that, you know, oftentimes what's so important here is starting to develop comfort with something that staff know really well, to begin to understand where AI tools can misfire and where they're really potentially adding value. The earlier panel talked a lot about the need to have improved forms of evaluation, and I oftentimes get looped into calls where there are government agency partners who kind of ask like, hey, can you tell us basically whether this is a form of good technology or AI snake oil? And that's, you know, where a lot of the kind of knowledge gap can be. And we have to think about better forms of evaluation. David mentioned the private sector. One major New York firm, Paul Weiss, acquired a license to Harvey, one of the large legal AI vendors. And one of the striking things is they threw a bunch of junior associates at Harvey to use the tool. And at the end of the day, they could not figure out how to evaluate whether it was actually improving the legal practice. So the one thing they settled on was just, do the junior associates like using this tool? That is, of course, one important metric, but it cannot be the be-all and end-all of how we evaluate it. Do people like it? Because there are lots of things people like that may not actually be productivity enhancing and improve the public sector overall.
Thank you both so much to City Attorney Chu and Professor Ho. Check. All right, the mic is back. Thank you both so much. Such an insightful discussion. Thank you, David. I appreciate your time. Those were great use cases. Let's get rid of reports and commissions of commissions, right? Not all. Next, you're going to hear about how other city departments are doing this. This is our final portion of the program today, and this is how it works. It's my favorite. Departments are going to do a lightning round. 5 different city departments, 5 minutes each. A time limit because I told them that they're standing in your way of lunch. So they will keep to the 5-minute time limit. So help me welcome up to the stage Dr. Carolyn Coles from the San Francisco Police Department. Ethan, hold your applauses. This is where they say on the Oscars, you hold your applauses till the end. Ethan Billigmeyer from the San Francisco Public Utilities Commission. Amy Martin from Digital Services. Robert Baca from the Mayor's Office of Housing and Community Development. And last but not least, Leah Greenbaum from the Department of Emergency Management.
Okay, I have 5 minutes. Okay, good morning. There we go. I'm Dr. Carolyn Coles. I'm an embedded criminologist with the San Francisco Police Department, and I'm going to share a pilot experiment that we conducted to test AI-generated report writing software. So our problem statement was simple. It was, should we buy this software? And embedded in that, we wanted to understand if it was going to save time, officer report writing time, if it was going to create more policing, so more activity out in the street, the cost-benefit analysis of it, and then supplementally, we wanted to do a quality of report assessment with the district attorney's office. So it was a quasi-experiment, meaning that we didn't randomly assign anyone to it. We had challenging proxies because there is no individual metric that determines how much time an officer spends on a report. They did self-report time savings, and we internally tracked the AI written reports and set them aside from the human written reports. We did this for 90 days. So how we did it, we took 4 different districts in the department and we assigned 2 of them the AI software, 2 of them was business as usual. There we go. And then at the end of it, we compared their policing activity. On the district attorney office side, we had 13 ADAs. We took all of those final reports and we found a human written version of a similar type of report that from the same officer, and had the district attorney's office, the ADAs there, to assess the quality of the reports based on a rubric that we created internally. And then we averaged the scores in the report and compared the human versus the AI report based on the quality of the report. Now, a whole lot of numbers coming at you. Okay. I'll just tell you what we found at the end. So the statistical analysis in the police department found that there was no increase in police activity. And they did self-report that there were 18 minutes saved time, but we're not sure where that 18 minutes went. I'll talk more about that later. It's not a bad thing. It's not a bad thing. On the district attorney's side, they did rate the AI-generated report as higher quality than the human-rated report. So in summary, there were 1,500 qualifying reports in this 90-day time period, and we had 41 generated, which means officers were not using the software, which is a signal to me of usage of the software. We had a 27% officer adoption rate, and I asked the ADAs to assume which report was which, and they were no better at chance at finding an AI report, and they were a little bit better at identifying a human report. Okay, so what we still don't know. At the top is a quote from one of the officers when I was in district and getting some feedback from them. So that's how they feel. So the time savings, we don't know where the time went, like I mentioned before. It could have been more community policing. It could have been a lunch break. It could have been a bathroom break. It's not inherently negative that we don't know where the time was, but using the proxies that I used, it didn't produce more policing, which is one of the outcomes that we were looking at specifically. We don't know the impact of high quality reports on the criminal justice system. What does that actually mean? Does that mean a faster conviction? Does that mean more clarity in some other way? We just don't know. We also don't know how AI-generated reports I just got the 1 minute, so now I'm speeding up. How the AI-generated reports hold up in the court of law. They haven't been processed in California yet. We don't know community opinions. We haven't asked the community how they feel about the police department using AI-generated reports. And lastly, this is a Senate bill that requires the police department to keep the first record. We don't know the labor that entails. So all that to say, we did not purchase this software at this time. Doesn't mean we won't in the future, but right now there are too many unknowns. Thank you.
Hello, everyone. My name is Ethan Billigmeyer. I am a wildfire mitigation specialist with Hetch Hetchy Water and Power. We're a part of the SFPUC that delivers clean electricity made from moving water. Traveling cuts through the remote wilderness, steep canyons, dense forest, rugged terrain. Some of these areas you can only reach by helicopter. It's very beautiful country, but also has some very high wildfire risk. So problem statement, on any given day, our crews are out in rugged terrain, mountainous terrain, maintaining water and power infrastructure. A lot of places most people will never see. So this means you can turn on your lights, your tap water, and you don't have to think about it. However, the wildfire risk is high, as I mentioned, and it directly shapes where we send people, when people can safely work, and how we protect both our infrastructure and our staff. A few years ago, we were relying on one remote access weather station to provide fire weather conditions in our work areas and piecing together weather information from multiple sources to assess wildfire risk. It ate up a lot of staff time, and by the time we had those conditions, sometimes the weather would be changing. So we decided to go with a vendor, TechnoSilva. They provide a wildfire analyst. It's a vendor-supported proprietary web-based application. It uses AI-powered algorithms to produce a fire potential index. It uses machine learning to analyze detailed weather, wind, moisture, and environmental conditions. And it's built to provide location-specific wildfire insights tailored specifically for utility operations. It enhances generalized remote access weather data with granular utility relevant observations from 300 plus publicly owned weather stations, and provides color-coded green, yellow, red grids for immediate risk interpretation. This was originally adopted by Hetch Hetchy Water and Power, but is now expanded across SFPUC Water Enterprise, ensuring shared situational awareness across more teams. So outreach and impacts, obviously it's operational speed and efficiency. It's a reduced need for daily phone calls to federal service lines to find out what the fire conditions are that day. It's reduced need for manual data acquisition, and it helps increase decision support work. And the outcomes and impacts, the system generates automated daily reports that are emailed to crews and leadership every morning before work starts. It provides more accurate forecasting of conditions that may require the line de-energization, such for wind events. And then teams rely on a single source of information, so it improves alignment and reduces guesswork. It also improves safety and preparedness. Field operations can proactively adjust to schedules, resources, and patrols. Higher situational awareness reduces wildfire risk. And slide 6 is real-world impact. Granular real-time data tailored to our utility operations. It reduces risk, it's faster readiness, and shared operational awareness. And this is some pictures showing some of our linemen doing some really dangerous pole work using a helicopter, and we used this application to make sure that the wind was right, make sure the fire danger level was low before they actually placed that pole. Thank you.
Thank you.
Yes, it's really me this time. My name is Amy Martin. Good morning. My pronouns are she and her. I'm part of the digital services team, which is part of the city administrator's office. So the Department of Justice ruled in 2024 to update the Americans with Disabilities Act to include for the first time clear and measurable standards for digital accessibility. This is a good thing, but it's created some challenges for state and local governments. Web Content Accessibility Guidelines, or WCAG 2.1 AA, is now the benchmark to meet by April 2026 for all content on sf.gov, the city's unified website. Content that's not accessible is already not usable by people with disabilities. Now add to that, if it's not made accessible by April 2026, it will expose the city and county to legal action from members of the public. PDFs, in particular, present accessibility challenges for users, and on top of that, they're quite hard to make accessible. And departments don't have extra staff to take on this remediation workload. This leaves SF.gov with its 42,000 PDFs, which I would venture to say are all or mostly inaccessible, in a bit of a pickle. Editors who work on SF.gov are challenged by the task of remediation itself, and even more so by the sheer volume of PDFs in their hands. They have access to almost no metadata about the PDFs, including who they belong to and how many times they. Helping editors know where to start feels like a crucial task, and so how might we support SF.gov editors in focusing limited PDF remediation resources on the highest priority documents, given the data and usage and ownership is separate from the CMS and can't be accessed independently by editors? So I'm not an engineer. I was a public librarian for 17 years, including most of that as a children's librarian. Love SFPL, but I have to shout out Oakland Public, where I spent most of that time. And then I jumped into digital services at City and County of San Francisco. I learned about prompt engineering from an AI hackathon that we held in digital services in the spring. So I got my start by editing and reusing the sample prompts from that session, and eventually I learned more about prompting from some easy sort of beginner-centered sources like The Neuron, which is a newsletter I subscribe to. The problem of helping SF.gov editors prioritize their PDFs for remediation felt AI-shaped to me, because we did have one big advantage. SF.gov engineers were able to get a one-time extract of usage data for PDFs. So it was a matter of combining that information with other data that we had or could get about the files, then breaking it down by department for sharing. And we could use reports about this data to steer department partners toward top-viewed PDFs to remediate first, cutting through the fog of overwhelm. So I used ChatGPT to write Python scripts, then ran them in a Jupyter notebook. Some of the things that we did with those scripts, we scraped SF.gov gradually. That was a lesson learned for URLs ending in .pdf. So we built a large data set of PDFs by departments who own them. We partnered with engineering team to get a one-time export of that usage data, and then wrote Python scripts to combine very enormous data sets into a single one. The last thing I did was build Excel reports that identified all the PDFs with their owning agencies, highlighted fillable forms, and incorporated usage data. The impact of this was that we were able to send a priority 1 PDF report to each department that has a presence on SF.gov. For each department's PDFs, we were able to show the percentile of views compared to all other documents, files, PDFs on SF.gov. That gave people a sense of the importance of remediating their particular set of PDFs, and was our way of saying, laser focus on this subset of PDFs first, and save these other less viewed ones for a little bit further down the line. Departments have been really happy with this because it gives them a sense of where to start their PDF remediation efforts instead of trying to fix everything all at once. Engagement has been really high around the reports, and in fact, every time I open up one of them in Excel, almost every time I see someone from the department in there reading it. I've gotten a lot of thank you messages. You can see some of them up here, and a lot of messages from people just starting their PDF remediation journey who feel more confident about getting started. I'm really happy I've been able to help people narrow down a very large and challenging body of work, and I'm happy that I've been able to do this as a city and county employee with no coding background. Thanks.
Oh, man. There we go. I'm pretty hungry, so I'm going to try to be quick. Robert Baca. I'm a housing director at the Mayor's Office of Housing and Community Development. MoCD is a city's lender for affordable housing and infrastructure. We oversee highly complicated projects from conception all the way through construction and through asset management. We loan anywhere from $300 to $500 million a year in housing infrastructure loans. And like a lot of our sister agencies, our work is highly complex. And really what determines success is really the quality of information, which depends on the data and the analytics that our team does. So the problem has always existed for us, especially in housing development. This work has been is always highly document heavy and time sensitive. Every project generates thousands of pages of information scattered through contracts, budgets, policies, memos, and emails. Staff is expected to synthesize, which is really key. We're expected to synthesize that information and apply judgment and move quickly, knowing that mistakes can have real financial and social consequences. So what change isn't the problem continues to exist. It's really the tools. And our work is very rule-driven, it's analytical, and it's document-based, which is perfect for Gen AI. And we started small and practical. We were given the opportunity to sign up for OpenAI City Enterprise licenses. And we really committed to an augmented AI approach, which is human interaction, oversight with AI. And we really focus on a retrieval augmented generation framework where we're pulling from project documentation and not relying on the data that kind of fuels LLM like ChatGPT. And so we really were able to leverage the power of an LLM, which is really, when it comes down to it, it's a mathematical prediction machine. And so the first pilot application that we did is that we used ChatGPT Project, and we built project-specific knowledge bases that centralize all the project documentation in one place and act as an assistant project manager and analyst. A single central source of thousands of pages of information accessible in seconds. And what was most critical is we're able to synthesize that information at the project level and in different situations. The second pilot application is that we started building some pilot custom GPTs for our loan underwriting, insurance compliance, pre-construction oversight, and contract reviews. And again, using the RAG setup, we're pulling from OCD policies and requirements. So instead of searching through thousands of PDFs and documents manually, we're able to ask it questions and we're able to get sourced answers in seconds, and the key is sourced. So some of the outcomes that has come from this really short pilot using ChatGPT is that the impact has been real and immediate. We've reduced hundreds of hours of document searching. Policy interpretation has been more consistent, and decision-making faster and more sound. So we're giving highly skilled professionals better tools to do complex public sector work, faster, more consistency, and most key, it's less friction. Thank you.
Okay, I've got no numbers for you, so I think that's why they chose this project for last. I'm with the Department of Emergency Management, and we are the department that sends those Alert SF text messages that you get on your phone when there's an emergency telling you to avoid the area or to walk 2 blocks inland when there's a tsunami warning. And I'm going to let you in on a little secret, which is that we don't often get love letters from the public about our emergency messages. We rarely hear from people, oh, I loved that Alert SF. It was so timely. It was so detailed. It told me exactly what I needed to know, and it was concise. And there are good reasons for that. The people who write those alerts have a real bias towards operational jargon. They're often written under intense time pressure. The information can be really incomplete that you're getting when you're developing those alerts. And so since tools like ChatGPT have gone mainstream, emergency managers have wondered, can AI do this better? They've wondered, they've worried, they've fretted. And we could have quietly tested that hypothesis, but we wanted to have a little bit of fun. So we built a game show that pitted AI against a human volunteer, against our Alert SF templates, and we held that game show in front of a live audience at Manny's in the Mission on a Thursday night, just a fun way to get feedback from a live audience. We posed a series of emergency scenarios to them, and then we had one of our alerting specialists use our Alert SF templates to send out, draft a message for that scenario. We had a very brave audience volunteer who had never written an emergency alert before in her life, offer to do one in real time for us, and we had our communications manager prompt GPT with details from the scenario, and we got a GPT-driven alert. And then we threw them up on a board and compared them. So I'm gonna give you one of our scenarios right now. This is feels like a true-to-life scenario. You have an explosion, you hear that the 911 system is getting overwhelmed with calls, you're having someone tell you, we need this message out now, go, 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 and you don't have all of the information and the clarity that you want in the moment. You don't know if you're looking at a coordinated attack or fireworks or a car backfiring, right? But you gotta go. So we had our 3 alerting specialists develop messages, and we can guess who wrote which one if you want right now. So message number 1, avoid the area of Main Street near Fisherman's Wharf due to fire activity. Emergency crews are on scene. A little vague. Doesn't mention the 911 issue that we're having where 911 is getting overrun with calls. Our second message, explosion at Fisherman's Wharf. Please don't call 911. Emergency crews are working on it. So says the word explosion, which is kind of a no-no in emergency management. Little sensational, can counterintuitively drive people to the scene to go check it out, and also cause panic. The language is a little bit informal about not calling 911 as well, so that can be a little misleading. And then we have the third one, really precise message. It tells you what to do. It gives a message on the 911 getting overloaded with calls issue, and it offers a URL where you can find updates. Does anyone want to guess who wrote which one? So number 1, anyone have a guess? Yeah, so it's a template, so it should look familiar to you. You probably see these go out on the Alert SF system a lot. The second one, I didn't mention. That was a human, really good attempt. But you get stressed when you have these situations, and it's hard to know how to articulate, right? And then our third one was GPT. We chose this, we had a number of different scenarios. And in this one, AI wrote the best one. It has structure, it has good restraint, it has empathy, it has really clear directions. And what surprised us about doing this wasn't that the template won every time or that AI wrote the best one every time. It was that it was different. There were times when when there was a red herring in the scenario and AI kind of ran with it in a weird, misleading way. There were times when the Alert SF templates that we have that are carefully considered ahead of time were the more appropriate choice. And then there were times when our human volunteer from the audience who had never written an emergency alert in her life wrote the best one and really took the cake. So what we got from this was that this was a really good opportunity to talk to folks about the challenges of writing emergency alerts. We loved getting feedback from a live audience. No better way than a Thursday night at Manny's to hear what the public really thinks about something. Is AI writing our Alert SFs? Absolutely not. We still develop our templates through a committee, through a very carefully considered process. But right now we're building a really robust, centralized library of pre-translated templates. And AI has been an important support tool in making sure that those templates meet best practices, in helping us develop messages that are consistent across different character limits and system formats. And like Mayor Lurie said, this is helping us solve a problem in a more human way with AI as an important support tool. So thank you.
Such great use cases. Thank you, everyone. Thank you so much for participating. And if you want to get up on stage next year, call us, okay? Work with the Emerging Technologies team. I really appreciate all of these presenters today. As we wrap up, I would like to welcome back to the stage City CIO Michael Maxman to share a little bit about where the city's AI journey is headed.
Thank you, Jane. What a fabulous lightning round panel. Another round of applause for the brave folks from the departments who talked to us about their use cases. Okay, well, I am really standing between you and lunch, and so I'll try to be quick, but I can't be too quick without thanking Jane, who's put a lot of countless hours in making this happen. I want to start with thanking all of the speakers, panelists, department presenters, everyone who helped this morning, making this morning possible. Special shout outs again to our wonderful San Francisco Library partners for hosting us, to SFGovTV, the folks who made sure that if you couldn't be here in person, you could still see and participate in this wonderful morning. And to our emerging technology team, I don't know if you know, there's 3 of them. The entire team is here. That's Viviana, Tanya, and Jane. Everything you heard today, all the expectations, the hopes, the promise of AI, this wonderful team is taking on, right? We're gonna give them more resources so they're not dying, but they've done so much in the last year. So much thanks to all of you for making this possible. And I want to talk to you today just very briefly about what's next. I think you've heard today that AI is not just a buzzword for us, right? It has real implications. And even when we learn something about not using AI team, thank you SFPD for being brave enough to present a case that actually didn't turn out as you expected. That's also part of this AI journey. But what everyone has said is that AI is not about tools, right? It's about that outcome. It's about making our crews in Hetchy safer. It's about our alerts more human, right? It's about saving time for folks who are already so stretched. That's what we heard today. And from taking from policy to legal implication to frontline department pilots, we've shown that AI can make our lives better, be government service more responsive, more equitable, more human. So over the past year, we've focused on laying the foundation. We've tried a lot of things. We've given the tools like ChatGPT and Copilot into the hands of city staff. We encourage a lot of experimentations because there's no roadmap, there's no playbook that came with those tools. We built our AI guidelines, and we updated them recently to make it easier to actually use AI, but use AI in a more responsible, transparent, safe ways. We're training city leaders, you've heard today, everyone from department heads to managers to staff. We're strengthening governance transparency. We are thinking about the environment, and we just posted a new environment guidelines, one of the first in the nations. Thank you, Viviana, for doing that. We're creating spaces like this forum. Foundation is in place. We had to get this work done. We had to figure out what our roadmap is. And so I'm really excited to talk to you a little bit and announce that we're moving into the second phase of our AI work in 2026. This is the work where we are going to move faster, we're going to be much more intentional, and we're going to bring a lot more resources to experiment boldly, to see what works and scale it, to focus on a few really, really important, really big use cases that really matter to the city. We believe with the strong guardrails that we've built, we can do this. You can't drive a good car without good brakes. And we're ready to drive this car boldly. We're ready to go forward in 2026 with all of you to really make a difference with AI. And today we're going to be talking more. The mayor announced our partnership for new civic innovation, a new type of way to actually do AI work with SF Science, City Science Lab. This is a first for the city government partnership that will pair real city challenges with technologists in the public and researchers from academia who want to help us solve the problems. This is the way to really inject fuel and supercharge our work. We've begun identifying our first project areas. There was many that were submitted. We're being very thoughtful, very intentional with the ones we're choosing, and we'll be sharing more in the coming weeks with all of you. This is how we turn clear problems into responsible, early pilots that we can scale. We'll focus on a few, but we'll focus on the few that really matter. All right, I also want to remind you that tonight there'll be an event with an amazing person. One City, One Book celebrates Dr. Fei-Fei Li, her story of insights, of how human-centered AI can be here is the grounding that we're also using to evolve our program. Please come and join us. And for those who want more hands-on work, keep learning, we have a special Friday's Food for Thought. That's coming up this Friday. We'll be focusing on AI and coding. You heard an amazing story from our partners in digital services, a former librarian who wrote Python code. How amazing is that, right? Anybody and everybody with a desire can do amazing things in this city, and we certainly need that. The AI Food for Thought is informal, just to help you supercharge your service delivery. Now, and if today, and I hope today really did spark your enthusiasm and some ideas for you, or maybe raise questions, we want to hear from you. Reach out to Jane with all of your questions and all of your ideas. We actually want your use cases. I heard I saw some people raise hands and say, oh yeah, I could do this. I want to do this. Do let us know. We want to hear from you. We want to help you tackle those challenges, workflows that frustrate you, areas where I think one of the speakers, I think it was Derek, who was saying, hey, I'm spending so much time, but it is not the best use of my time. I just have to do it. Can AI help you? It probably can. Let us know, and we'll help you get started. Thank you, everybody. Thanks for the folks in the audience. Thank you, everybody online. Thank you for the work that you do as city staff every day. I hope you're inspired, curious, ready to explore responsibly. And to the channel, MDL, go San Francisco!